Meaningful partnership and inclusion in the stewardship and protection of their cultural resources and homelands. Take a moment to honor these ancestral grounds that we are collectively gathered upon and support the resilience and strength that all Indigenous people have shown worldwide. We're currently meeting here at First Five California in Sacramento, which is the ancestral homeland of the Nisenan, Maidu, Miwok peoples, who are the indigenous peoples of this land and have lived here since time immemorial.
Thank you so much. It's wonderful to be here. It's our first meeting of the year. And I just want to express a deep amount of gratitude to all of our First Five California staff members and team members and partners who accomplished so much last year. 2024 is going to be a big year. We have lots of exciting things happening this year, including strategic planning that we'll learn more about. And we'll do it all together. So I just wanted to express gratitude and to my fellow commissioners. This is our kickoff commission meeting in person again. Thanks to our regulations of the Bagley-Keene Act, we will be in person and appreciative of everyone being here on a regular basis. Recognize deeply the work locally in a variety of locations. We will be having our meetings here in Sacramento now, but throughout the year, we'll be meeting throughout California, and appreciate everyone for traveling and being able to see all the good work happening with young people 0 to 5 throughout the state. For this meeting, as I mentioned a little bit, unfortunately, due to some timing and logistics and a full agenda, we weren't able to put together a site visit, but I want to really express a deep gratitude to the Refugee Enhancement Development Association for considering hosting us. We will absolutely find another time to come back and visit, and we are grateful for the partnership that we have with them. And in our meeting, we'll look forward to First Five Sacramento and Rita's presentation later on. So, thank you very much. I wanted to just to provide a brief overview about what some of our discussions will be. We are going to, in order to maintain some quorum and logistics throughout our meeting, we're actually going to go into closed session first. We have an item that we will be discussing in there as well. And then we're going to come out and we'll have a consent calendar, which includes 2 items. Commissioners will then present regular action items. So again, sort of taking our agenda out of order, we'll review the 2023 annual report, smoking cessation, we'll do the vice chair election and the advisory committee assignments. And we'll finish with 3 information items: a financial update, small populations county funding augmentation, and end with the fatherhood initiative. So very excited about our entire agenda. So thank you all. I wanted to ask my fellow commissioners if there is a conflict of interest that you may have. As you know, for each meeting, we ask the question whether any item presented on the agenda for you either presents or may potentially present a conflict of interest for you. Obtaining this information in advance will ensure that I can announce your non-participation in any aspects of the item in compliance with applicable laws. So to my fellow commissioners, do any of you want to say the conflict of interest on any item that you may have at this time? Okay, thank you so much. And we are now going into closed session. You guys get to stay here. we will leave, we are going into closed session under Government Code Section 11126A. The California Children and Families Commission provides public notice that we're going to go into closed session regarding the appointment, employment, evaluation of performance or dismissal, discipline, or release of a public employee, or a complaint or charge against a public employee. Public employees include persons exempt from the Civil Service Act under Article 7, Section 4E of the California Constitution. And then when we come out of closed session, we'll report. And we'll consider reporting. So please take care. We're going to go into closed session with our attorney, and it looks like there might be a comment.
Is there a public comment before?
I'm glad we have our legal counsel with us. So, please, enjoy yourself. There's candy. Water will come back as soon as we can. Great to see everybody. And, we come out. And I want to thank everyone for your grace and your patience. We have, while we have no action to report, one of the honors that we have as commission is to evaluate our executive director. And so we've had that opportunity, and in order to comply with all the government regulations, everything that we talk about is in the room. And so we are grateful to you for your patience as we had that conversation. So thank you very much. Support, but it's exciting as one of our duties and responsibilities that we were able to carry out that endeavor is good governance and good practice. So thank you. We'll move on now to item number 3. Items on the consent calendar are to be considered routine and will be enacted by one motion followed by a vote. But there will be no separate discussion of these items unless the commission, audience, or staff requests specific items to be removed from the consent calendar for separate discussion and action. Any agenda item removed will be voted upon following the motion to approve the consent calendar. So I asked my commissioners, does a commissioner or a member of the public wish to pull any other item from the consent? Seeing none, I will call for a motion to approve the consent calendar. Thank you. Jamie, would you call the vote?
Jackson, second, okay.
Katie Albright,
Aye.
Shana Hazen,
Aye.
Jimenez, Jackie Majors,
Aye.
Vivian Velasco Paz, Lori Rochelle.
Aye. Thank you. Unanimous. Thank you very much. And we are grateful to our city attorney for supporting our work. Sorry.
Thank you very much.
I'm in the county, I'm still in the county, for supporting our work. Thank you so much.
Have a great
Now,
meeting.
I think I should have actually taken, public comment before the vote. Any public comment on the consent calendar? Okay. Seeing none, thank you so much for that. Our next item on the agenda, I'd like to welcome, Dr. Martha Dominguez, Deputy Director of Program Innovation and Evaluation, to present the annual report. This is item number 6, fiscal year 2022-2023 annual report. Thank you, Ms. Dr. Dominguez.
Hi, good morning. Yes, it is. Good morning. Thank you for the opportunity to go over and highlight some amazing data and some wonderful investments that collectively we have all done in the last fiscal year. I also want to recognize that for some of us, this is our first annual report, and for others, it's a continuous. So I think it's just a nice opportunity for us to highlight all of our wonderful investments and just to recalibrate us on where we have done and where we want to keep going. So next slide. I think you all have the draft annual report in your binders and your packets. So, this is essentially an overview of what we have done collectively as a group, as a unit. But we'll go over all the different content that, is outlined here in this, outline. Next slide. So I think one wonderful thing that First Five California has done collectively with the commission is to really establish the North Star in audacious goals. So this has been front and center of everything that the team has done, both at the state and also that we infuse to our local partners and also with our external partners. We want to make sure that eventually and every child in California has the best possible start in life and starts from an equity perspective as we progress through their life course. Next slide. Another important reminder that I know Jackie has been reminding us in the last couple of meetings is essentially just the recalibration of making sure that the North Star in Audacious Gold has a result-based accountability and that we have our framework and our principles. And it's all based off the theory of change. And also just to remind us of the system leverage that First Five California does, from advocacy, being conveners, being catalysts, and broadcasters. And we know this is something that we are trying to do from a collective impact approach. So everything that we do, we're always looking at it from that perspective. And we're also making sure that everything that we do has a result-based accountability with some quality improvement along the way. Next slide. Couple of highlights in the last state fiscal year from 2022 to 2023. Again, as I said, First Five California just recalibrated to ensure that all the work and investment is rooted in equity and making sure that all of our new investments from the different streams that we do and the pillars that we do, whether if it's investments on the childhood workforce, on the behavioral health, on the newcomer support, or through the children data and indicators that we'll be doing and the fatherhood investment, that everything has that lens from the result-based accountability, but also North Star and Audacious Goal are front and center. Just some highlights, I think a lot of us already know, but 125 million has been invested on impact, which is the improve and maximize programs so all children thrive legacy. This is a huge investment and it's a wonderful program that collectively the state has been running and collectively with our partners at the local level. Another huge investment that started with at the governor's office and it has included multi agencies and multidisciplinary partners is ensuring that behavioral health is front and center. First Five has reminded a lot of our different partners that 0 to 5 population is really critical. We do know that a lot of investment has been on the youth, but First Five California is investing 10 million to ensure that our 0 to 5 population is front and center with behavioral health efforts. Another thing that's underway is a $2 million investment to encapsulate everything that First Five has done in the last 25 years. Essentially is a look back report that we'll be summarizing since the inception of the Proposition 10, which is something really exciting for us to show and tell, but also to remind folks of the wonderful investments that have been done over the years. The other thing that we're super excited is the $3 million investment with Children's Data Network, which will be looking at population data landscape, but also establishing indicators that really will align us and hold us accountable for the result-based accountability, but ensuring that North Star and Audacious Goal are all aligned. And then another wonderful project that we've been doing to engage males is really our fatherhood initiative. We've been doing some foundational research, which you guys, that's in your packet as well. Next slide. Some continual investments that we've done, as you all know, is the home visiting coordination, which is a huge investment, but also to our partnerships with other state agencies such as public health and social services. We've been doing a lot of wonderful work at the state and investing those dollars. And then the other part as a small population county funding augmentation, which we'll have a presentation later, but that's a huge partnership that we have with all of our local partners and the investment that's been done. The Dragon Song, how can we not forget that, right? The Dragon Song has just created a wonderful awareness and the importance of making sure that children and caregivers are connected in their emotions. And then we spinned off with the Stronger Starts to really address some of the toxic stress and really make the connections with ACEs. So that's a wonderful investment that we've been doing. We can't do everything, ourselves, so we have to, make sure that we invest in partnerships and relationships across California. And we've been doing that with some of our major influencers within our communities, which includes sports, organizations such as the Sacramento Kings, LA Dodgers, and others. But we have also had some great partnerships with the zoos, the animal connections that allows families to make those connections, but also with ethnic media, Univision, and we also have PBS Kids and then Doggy Land. These are just some of the key partnerships that we have that allows us to elongate and amplify our messaging, but also the partnerships and the education with our community. Next slide. A couple of things that we've done in the policy field is, in terms of our policy pillars, and I'm sorry if that slide is not really clear, but hopefully you have it in your packet, that's easier. But 4 pillars we had is to build resilience among families and community, optimize child health, promote sustainability of early childhood investment, and strengthen the state's quality early learning mixed delivery system, which we've done some great work to help ratify the Child Care Providers Union Agreement. So that was a huge win for us. And also to some other details in terms of the family leave and family support, but also to the expertise of our team. I do want to take a minute to acknowledge the team here at First by California. They were able to provide some testimonials at the informational hearing on the Assembly Select Committee on California's mental health and highlight some of the resources and investments that we've been doing, such as our campaign, but also our kit, and then just the resources that we've been developing to support the families. And then also to, as you guys know, any type of policy advocacy, we need strong partnerships, and we wanted to highlight one that we are very proud of, and we'll continue to do other partnerships with our stakeholders, but also other constituents across the state. But the Office of Community Partnerships, Strategic Communications, which is under the governor's office, that's been a key partner for First by California. But we're really proud of the policy work that we've been doing, and just wanted to take a moment to highlight those wins for us. Next slide. On this slide, we just wanted to highlight and connect the dots of the 4 result areas, which is, as you know, family resilience, child development, child health, systems of care. One of the wonderful things is collectively, as you have approved in the last year, over 285 million. That's allowed us to really put those dollars into work and really show that this is a good government program that has been effective. It continues to make improvements at the local level, but also at the individual level with children and families. Next slide. The next couple of slides are really key result areas, and you have the data, and I won't go through every single specific data piece, but it gives you a lot of the information of the indicators that we've been tracking. For family resilience, we've had an investment over $96 million. We've invested in key selected areas such as family support, literacy and books, and also our media campaign and PR efforts, which really helps us to build that momentum. Next slide. On our child development area, we've invested over collectively as a group $78 million. And we looked at the quality early learning support, early learning programs or costs, which really includes some of the programs such as Impact 2020, Early Math Project, Imagination Library, our tobacco efforts, our refugee family support, and our SPCFA efforts. So this is also part of all the part of this result area. Next slide. Child health. I love this result area. And collectively as a group, we've invested over $109 million. And this really includes services such as health education and promotion, oral health, as we know it's really critical in treatment, early intervention, prenatal, early childhood with home visiting, and also infant, toddler, pediatric support. These are areas that we've been investing and we've been tracking who we've been touching as a unit or as a group. Next slide. is the last result area, which is the systems of care. And collectively, as a group, we've invested over $85 million. We've really been focusing on policy and public advocacy, system building, and emergency disaster relief, which we know in some of our areas in California have been impacted, and we'll highlight that in other presentation. Next slide. I think we've been talking about this for the last couple of meetings, but just as a reminder, I think you all know this, but the allocation that the first by California is 20%, and then 80% goes out to the county commission, and then our 20%, we break it out at the right-hand side. Hopefully you guys could see those numbers, but essentially the 20% gets divided into administration, unallocated research and development, childcare, education, mass media communication. So those are our key areas where we divide up our funding, and most of the funding also goes back out to a lot of our partners that already receive the 80%. Next slide. This is revenues of source. We wanted to do a list and provide the numbers. You'll see that over $417 million has been allocated and represented across all 58 counties. This is just a reminder of the different allocations that we've had. Next slide. The next also couple of slides are demographic data that we wanted to kind of share, and this is something that we've been reporting. But this is the demographic population curve based on age. You can see the total numbers at the bottom, but also we did a breakdown between 0 to 3, which is also a critical area, but also 3 to 6. And also there's some data that we were not clear because it's unknown. So we were able to couch that information, but we also had data on primary caregivers and providers. And then we had just total children 0 to 5, and then primary caregivers as well. And just as I'm speaking, I also just want to remind you all that this data is based on what we receive from our local partners and the information. So some of it may not be fully complete and depending on who submitted their data. Next slide. This is the breakdown of race and ethnicity. So we have to break down and we align this race and ethnicity with the census glossary. We will be examining that, as we've known from this last census 2020, that there's been an increase of identifiers of race and ethnicity in California, which is part of our effort of the cultural competency effort, and also being result-based accounting for how communities would like to be identified themselves. So this is just another breakdown of the numbers there. The next slide is on the language. This is also another great slide for us because it just reminds us of the multicultural and the beautiful communities that we serve here in California. You see also that English and Spanish are still predominantly the dominant languages, but we also have a couple of the Asian languages, which we know have also been part of California's history. So this is another just reminder of the efforts and the multifaceted ways of us reaching communities across the state. Next slide. The next couple of slides, we wanted to highlight a couple of county and this efforts, and this is based on what the counties have submitted to us. So we are very thankful, but it also too just shows a collective impact from what the state has put as a foundation, and the local partners are also enduring and implementing at the local level. Lassen, for example, has done some huge investments with home visiting, but also has gotten creative in making sure that they can have some graded funding and seeking funding from CalWORKS and also from the Department of Public Health. Nevada is also another great example of doing improvements on health equity, which really allows us to highlight their work and making sure that that's at the forefront. The other thing that Nevada reminded us, when there's challenges such as their Family Resource Center, one of them closed, their staff got creative and they were able to become really resilient. So that's just another reminder of how creative our local partners are at the local level. Next slide. Santa Cruz, the Baby Gateway Newborn Enrollment Program. They reach a lot of their participants, through all their hospitals. They also help them get enrolled in Medi-Cal and at the same time provide them a parent kit, which is also a nice reminder of the education. But they've also done some economic justice and with some of the work that they've done at the local level with the savings account, which is, aligns with what the state has been doing with the, child savings funds account, and then also just connecting folks with food, connecting them with CalFresh and with programs. Mariposa has been doing some great work and getting their school readiness program and also just establishing the STEM curriculum, which is really awesome, because we've also learned from research that STEM has also built some of that equity efforts across the different communities. And also, they've been working and enhancing our efforts from the Dolly Parton Imagination Library. So thank you for that. And then next slide. Tulare. Tulare, we thought it would be nice to highlight as one of their family centers was part of the national news this year where they had a horrific mass shooting. And as a community, they came together. They were able to provide resources to the community and families, but also were able to engage their local commissioner. So we're knowing that it's a collective effort as a team. San Bernardino reminds us of the great partnerships with Department of Public Health to ensure that oral health is at front and center. They launched a campaign and they even got an award. So, and this is all part of their partnerships that they were able to do. So that was a good, some good examples. Next slide. We just want to encourage you to read thoroughly the annual report, recognizing that for, again, as I said earlier, for some, this is the first annual report, and then for others, you've seen it before. But we're hoping to, we hope that you like it, and we hope that you find all of our investments that we've been doing in the last year good, but it's also just a reminder of a good program, government program funded and good dollars that went to good use. Happy to answer any questions that you may have.
Thank you so much, Dr. Nunez. It's so exciting, I have to say. As you know, I'm personally focused on family resource centers and family strengthening, and the highlight within the report around the good work that First Five is doing to invest in family resource centers. It's so critical. So thank you very, very much. I know we probably have some questions from the commissioners. We'll open it up.
Well, I will just ditto, we're also laser focused in the moment on what's going on, but it's so nice to take a look back. And while we may have differences throughout the year of what we feel like an investment should be made in, to see all these programs that have been delivered, and as someone who is a direct practitioner or works with lots and lots of children in LA, to see them being beneficiaries and their families is exciting. So thanks for the good work of putting it together. I did have a question about some of the demographic pages. Because I think you said more than once that, it's reported by the different counties. Is there just a way in the future that we can, invest in systems where those numbers we are feeling like are really accurate? I'm sure they're a great mirror of what's going out there, but because you mentioned it a couple of times, it seems like maybe there's room for us to grow in that area.
Yes, that most definitely. I think we want to look at ways for our partners to submit the data and making sure that we give them the option to ensure that they're able to categorize or that people can self-identify how they wish to do that. Because that's, from my previous experience working on the California Census, that was one effort that I learned, that the more that we give the communities the opportunity to self-identify, the more that they can be self-engaged. And we realize that in California, oftentimes we have biracial, bi-ethnical communities. So that's another area that we want to improve on. But I hear you, and that's an area that we hope to make that improvement.
And you really did speak to the biggest question I had of those demographics, which is the language. You had, you know, one of your highest numbers being Latino was close to 200,000, but your unknown was almost equivalent to
Yeah.
that. What does unknown mean?
They haven't reported that, or
Never
they
reported
wish
it,
not to
okay.
report that. So that's another area that we can improve on, understanding why they don't want to report it, or if it's more of a, just the data collection, aspect on the process.
Thank you for the good work.
Yes.
Yeah, so along those lines, I really appreciate the question because I was wondering about the demographics as well. And I think, well, first one, I appreciate gratitude, express gratitude for all the work that went into this. So really appreciate it. But in terms of demographically, adding just a little bit of clarity, what's there and what's not there is really helpful because hearing you say that it's an incomplete data set. So that for someone who doesn't have the luxury of hearing this presentation, that they understand what's included, and so it sounds like maybe some counties are included, some aren't, so just adding that I think is just really helpful, so that what we're putting out is clear and accurate. I also had some questions, sorry, just looking through my notes. So like around the theory of change and results-based accountability framework principles, I'm wondering if it needs to be here, and there were some things with the theory of change that, again, wasn't especially clear to me. I was thinking as an outside reader. And I think also the results-based accountability framework, I think we're all very excited about it, or I can speak for myself. But I don't know if there are examples of how it's being used that might be more useful than the way the information is shared. And I think just in general, there was some information that was shared in multiple places. So the more we can consolidate, I think there's, legislative and budget development section, and then there was the policy agenda, and a lot of it was the same information, good information. I think just being able to consolidate that a little more. Other questions that I have. Oh, I have a question. So in the media campaign section, there seemed to be an emphasis on API engagement. And I was wondering if that was something that we had prioritized, because that was called out, and was wondering if there were any other priority populations or not.
Yeah, I think with the media campaign, we are always focused on key populations, which includes, from the data that I shared, which includes, multicultural, Latino, African American, API, and as you know, and Native American. But with API, it's not a monolithic group.
Right.
We have to be mindful because of the language, but also the engagement. And having done ethnic media to reach API community, it looks very different than doing multicultural or English or traditional or even social media. So I think there's more intentionality in engaging them. But it's not to say that we're forgetting everybody else. It's just more the intention of work. But we're happy to make improvements or clarity on our next report to ensure that that's super clear.
For those of you who are, and I know Commissioner Makers, you may want to speak to it, but there's intentionality with kind of equity focus and a certain kind of when we think about ACEs and communities who are underserved, right? So with a certain medium income, right? Because we're trying to get our ACEs messages out there, right? And so the API languages, we actually recently kind of added them primarily because of a cost issue, because we were trying to figure some things out. We do everything in language in Spanish already because that's majority of students, so that's natural. We've been prioritizing African American community, kind of what that looks like. But API languages have over hundreds of different languages, so we go with the top 3 of you. We have Tagalog, they also speak English, Mandarin, Cantonese, right? So that's why we highlight it, because in a lot of media campaigns, they actually don't go that deep. Those multiple language
This was new for us.
correct.
Got it.
So as a commission who's actually invested in multilingual learners, it's actually important to ingrain in our practice and our investments, what we've actually learned from other investments. Is that
Yeah,
helpful?
That's helpful, yeah, because it's felt like a lot of time was spent on it, and I was like, there's something there that I wasn't getting.
Oh, no,
that's
we're
very
proud of
helpful.
it. If that,
Yeah.
if it's not a lot, a lot of words there, we spend majority
Yeah,
in
yeah.
Spanish, like if you think about multilingual work, but we're very proud of the fact that we're actually making a separate investment in data. Yeah.
Oh, and then this is just a question, I don't know if this is new for the annual report, and I can't remember the exact name of the section, but it's where we talk about there's the governance office, administrative services office, which feels very internally focused, and I didn't have a chance to compare it to previous annual reports. I'm wondering if that's new and why we're choosing, to share about it.
One, we're proud of the work of staff, but I think it was important for staff to be engaged and for, a lot of times what we say is kind of the backbone, they're kind of the behind the scenes folks. And really talking to staff, wanting to kind of share more of this is what we do, this is how we process, this is how, in addition to the county, we're thinking about a network report, this is what it is, it's both county and state of California. We thought we would highlight the work of the folks who are reporting more often behind the scenes. And that was important, but again, this is, we should have actually had draft all over it. If this is due by January 31st, I would also have to give kudos to staff because a lot of data
Yeah.
was received in December
And I know I'm sharing a lot of feedback, so.
and was received in December. We also don't have all county data, by the way, that's why it's incomplete.
Okay, so that's good.
No, we have a deadline to meet, so this report has to have the data that we have at the time to meet a statutory deadline of January 31st. So there are a handful of counties who do not give their information. We will not say who that is today because I think it's probably, so there are a handful of counties who do not. So that is, when we say incomplete, it's because there were, the reporting deadlines that were missed.
And there's no room to include. Has that happened in the past?
We're still missing the data.
Okay, so every year there.
As of today, we're still missing the data.
And I would argue it's like in the annual report, you get
That's
to a
right.
certain date.
Yeah.
You know, and most information you're looking at is highlights of the
Yeah.
past year, and those things we really want to bubble up or focus on more, yeah.
And I think to that point, I would just ask, maybe take a second and look at, and I defer to staff on the amount of, time space we've spent talking about all the different offices and internal work, so to your point of, key points that, highlights, which is not to say we don't, or I don't appreciate all of the work that is happening, but
Is the request to remove it before submission?
not necessarily. I think it could be less. And again, if it creates a whole administrative headache.
Thank you. Have to be clear, just because we
Yeah,
have literally 6
Yeah,
days.
yeah.
to
Oh, okay,
incorporate
so then maybe
that.
for next year, yeah.
We can, it just, we need to be super clear because it's literally 6 days.
Yeah.
Thank you so much. Commissioner Paz, Commissioner Jimenez, Commissioner Rizzo, questions, comments, thoughts?
Any questions I have already been addressed. I don't want to be redundant. I would just like to, I appreciate the highlighted counties and I appreciate all the hard work and passion. So I always like hearing about what's going on in all the counties. So I'm gonna call that out.
Commissioner Jimenez? No, nothing. Okay, Commissioner Paz?
No questions.
Thank you so much. I also have a question about the demographics, and this is really for next year. To think about, a column compared to what the California population is, so we can see the comparison, and also to be able to think about, putting in percentages, because that will help us in terms of the comparison. I think as we continue doing that, we focus work, really understanding the, who's being served, who's being reached, and who isn't, is super important. On the question of unknown, which may be declined to state, I would be curious, again, for the future, are organizations that are reporting this information, serving populations that may feel marginalized and in vulnerable circumstances, that they aren't able to report, and so they're censoring whether or not it's an immigration concern or domestic violence concern, that there may be a reason why they're not reporting. I certainly know that in human resource centers, that's one of the reasons why people don't report. Or an income issue that they may be concerned about. And if that is the case, are there ways of removing the barriers so that people can report?
Along those lines, I'm also curious if it may also be a capacity issue, particularly for small counties, just in terms of obtaining the data and being able to share that out with us, recognizing how tiny some of those steps are. Just nodding.
Maybe you should give anything else on that. Or it looked like you were.
Well, I was just gonna say, I think that across California, we're dealing with issues of trust and not getting information, but I would often say, and this is no, criticism to the tool, but a lot of times when people say unknown, it's because they don't really understand the question.
Yeah.
And so I would also just go back and revisit the tool. Yeah.
Honey, you could spend a lot of time talking about demographics, and the qualitative data is so interesting, so thank you very
Can
much.
I just add one last thing? Is there a way that the counties could know the data elements like now for next year?
So statutorily, we have to adopt them before, June, so it comes before the.
Okay, so they do
commission.
know.
Yes, so, and we would, because the commission has to adopt guidelines.
Okay, great. Because sometimes it's just hard to go back and get data if you don't go in knowing what the data elements are.
Yeah, so
Okay.
they know a full year before. And you won't approve it, like, so it'll come back, it should come back in May, the new kind of data. Meet our statutory deadline, it's all written out in the statute.
Are there any members of the public that have comments? Yes, we don't have an official sort of mic, so feel free to stand up or not, say your name.
Nina Machado, First 5 Amador.
Thank you.
Thank you for having us. And, we participate in the Imagination Library. So a lot of our participation, kind of our biggest numbers are through that particular program. And that doesn't collect demographics. So where I can say 70% of the age eligible children are participating, I can't tell you how many signed up for the Spanish book. You know, I mean, we can measure, but it doesn't collect, that particular program doesn't collect demographics. So something to ponder down the road because there'll be a large number.
Yes. Hi, Courtney from the First Side Association. I just wanted to make a comment on the 25 years of that reported on. I know this isn't about that item, so I'll just put it on public comment if that's safe for response. But we would love to continue to be involved in that. I think we did have one call the researchers or the potential researchers back in the late spring, but I haven't heard anything since. So just wanted to make sure that it continues to be on the radar that the association would love to be involved, and also Sarah Crow, who was with the association for and is now state, and so I don't know if that is a breakdown for the communication, but wanted to put it back on.
Keep Dr. Mayor by doing down.
Thank you.
Yes.
I'm Katie Mendon, First Side Kingdom, and I was one of the people not in Swan County, and there is always a bandwidth. I also wanted to add to that locally we really focus on impact data and how demographics demonstrate reach. We also really are wanting to ensure that our very small amount of funding provides impact and outcome. And so we're always trying to share that via the qualitative data. I think that's really a critical piece to think about when you're thinking about bandwidth as well.
Member of the public. Dr. Dominguez, thank you so much. And Director Wong, thank you so much. If I could call for a motion to approve, as Director Wong indicated, this is statutorily required that we submit an annual report to the governor and the legislature before the end of the. So if I could call for the following motion, I move to approve First 5 California's fiscal year 2022-2023 annual report and submission to the governor, the legislature, the county, and the county commission as required by statute.
So moved.
Thank you. Is there a second?
I'll second.
Thank you. If I could, call for a vote.
Katie Albright,
Aye.
Dana Hazen,
Aye.
Elsa Jimenez,
Aye.
Jackie Majors, aye. Vivian Velasco Paz,
Aye.
Lori Russo.
Aye. Thank you, for the unanimous approval of that. Thank you again to the entire team, Dr. to the honor of recording it, but the entire team did, we're partnering with you, I'm sure, as well as all the
This is a collective effort. of all.
After that, and we thank our county partners deeply for that.
And this is Dr. Dominguez's first annual report. She has yet to be with us for 6 months.
Yeah.
I hit the ground running.
Nice, nice. Thank you, great way to kick off the work. You are on again, Dr. Dominguez. Item number 7 is smoking cessation. This is an action item, and I will turn it to you to present the item.
Yes, thank you. And one of the things that I would like to be doing on the upcoming of my temperature here at First Five is also showcase my team. And I want to also introduce you guys or reintroduce you to our division supervisor, which is Kristen Torres. And she's going to walk you through the deck that we put together. And we just also want to acknowledge our partners here from CDPH, Tobacco Control Program, Gordon Sloss, and our partner at the University of San Diego, who runs the Kindle line, but let Kristen go through her show.
Thank you, Martha. We can move to the next slide, that would be great. So this is really just a reminder that tobacco education and cessation through our Smokers Helpline has been an ongoing investment for Southern California since 2001. We have funded the Smokers Helpline as an activity to meet our statutory requirement of the Children and Families Act. Picket California, the quit line, which was formerly known as the California Smokers Helpline, uses evidence-based educational approaches focused specifically on pregnant smokers, smoking parents, and caregivers of children ages 0 to 5, and as an effort to reduce and eliminate secondhand drug exposure to young children. Next slide, please. And then, of course, it's just going back to our First Five California theory of change. First Five California developed the results-based accountability framework that identified the process for establishing population level indicators, specific, measurable, achievable, relevant, and timely goals, or otherwise known as SMART goals, and performance measures that align to the North Star and audacious goal. So Picket California falls within the broadcaster First Five California system letter. Next slide, please. And so, this is really just reminding us why, in addition to our requirements to the act, why should First Five California check that cessation? So you all know the damage that smoking and secondhand exposure can cause. But smoking during pregnancy increases the risk to the pregnant person and their baby. And young children exposed to secondhand smoke are far greater at risk for SIDS and other infections such as ear infection, asthma, and pneumonia. Next slide, please. This is just a data slide showing 18 to 44-year-old women and their rate of smoking. The green dotted line shows a decreasing linear trend. And smoking, and just for reference, smoking here is defined as having ever smoked 100 cigarettes in a lifetime or currently smoking every day or some days. People, and reminding that people may not always know that they're pregnant for some time after conception. But the decline that we see here represents the many efforts across our state, including Picket California. They've done a fantastic job. But I also want to give credit to the mothers and parents who choose to help their child and the counties that are implementing the 211 services that connect directly to the helpline. Next slide, please. So here again, we can see the green dotted line, which shows a decreasing linear trend.
1.9% of California babies born equals about 8,000 babies a year. And it just, but keep in mind also with this data that it is unclear, we did use the maternal infant health assessment data. And it's unclear as to whether or not that includes or excludes postpartum people who do not identify as women, such as transgender and non-binary. When we look at the difference between the women of reproductive age slide previous and this, it's important to note that pregnant individuals typically quit during pregnancy, even though they may pick it back up again postpartum or post-breastfeeding. Next slide, please. This slide really is just to review some of the services that are provided through the Keep It California investment. So services are available in English, Spanish. There's also an Asian Smokers helpline that's available in Chinese, Cantonese, and Mandarin is what's included there, Korean and Vietnamese. There's also live chat, mobile apps, online videos, and automated text programs. There's also an interactive, user-friendly website at kickitca.org. And then Kick It California includes, I mentioned earlier, that connection for the county 211 to that helpline, which includes counseling protocol for pregnant smokers, which has been tested and proven in clinical trials to be effective. And pregnant smokers who received Kick It California's tailored counseling were twice as likely to quit smoking compared to those who only received the self-help materials. I think it's important also just to note here that there's just a great variety of approaches for assisting our target population. Next slide, please. Here are some samples of the ads and social media posts that come from Kick It California. This includes Facebook and Twitter several times a month. And so you can see here some of these posts target our veterans, LGBTQ plus, Spanish speaking populations, and breastfeeding peoples. Next slide, please. Here's a sample of a newer product that's been added into our kit for new parents. This is a window cling that parents can use to place inside their home or car to keep newborns safe from secondhand smoke, and it includes information about Kick It California services if they need some assistance. Next slide, please. There's also the ability for promotional materials to be co-branded with counties, and there's just some examples here of that effort. Slide, please. A little bit of an update. So on January 28, 2021, the commission approved up to $3.6 million for 3 years. And we're currently in the tail end of that funding. So about 2.5 years through that 3-year investment. During the 2.5 years, running from July 2021 until December of 2023, they've served nearly 8,000, so 7,780 pregnant individuals and parents of young children, which is about 12% of all the Kick It California clients. They received clients from nearly every California county and primarily served our low-income population, in which 78% of the clients were Medi-Cal recipients. And most of the clients were smokers, but 30% also vaped. Next slide, please. So this is just a demographic slide, identifying, just some of the first 5 clients versus non-first 5 clients. And again, just a reminder that, it's unclear, of those who do not identify as female. So that's an area of more improvement for us. Next slide, please. So how is Kick It California funded? Currently they're funded by 3 agencies. the California Department of Public Health, or CDPH, the Center for Disease Control, and First Fight California. The funding by each agency is proportionate to the populations of those agencies serve. With CDPH being the largest funder of the three at nearly 88%. Next slide, please. So specifically for Fight California funds, which is roughly currently about 12% of the funding, includes the telephone counseling, which is the majority of our budget currently, nicotine patches for medically eligible clients, IT support for the call centers and other service modalities, so that's that connection from the local 211 services, evaluation, and promotional outreach to tobacco users and health professionals. Next slide, please. So moving forward, we have our recommendations are a three-pronged approach. One would be to continue funding the California through a 3-year, $2.5 million commitment. In addition to leveraging First Fight California investments and resources, for example, as you saw with the new parent pay. And then maximizing our efforts through our collective initiatives, looking at how we can really reach through our others. And so again, I'll remind everyone that we do also have Gordon Floss from CDPH Tobacco Control and our partner for California, UC San Diego, Xu Hongzhu, which and they're with us in person today. So very good question.
Thank you so much for presenting. We really appreciate it. I just wanted to that I didn't know, and grateful to you. And thank you to our partners for all your incredible work to help reach California State. Open it up to commissioners for any comments or questions.
Is there action?
We do have to approve.
Okay, so my question is, what do we, being the recipient of tobacco tax dollars, what do we have to do?
So, part of the tobacco education association is also part of our statutory requirement. So this is one way that we've been fulfilling it. Obviously, our partners at the local level and some of our other efforts across the state have also been doing some tobacco education. Just for the first point of collective impact approach, we are also trying to maximize like the communications media efforts to ensure that there's promotion to the Kick It line, but also leveraging and uplifting some of the work that the locals are already doing that really fulfills a statutory requirement. We do feel that the Kick It California Smokers Helpline, that was back in the day, because I was at tobacco a couple of months ago. We still feel like it's a good investment. We just recognizing, given the climate of, of our declining revenue and our commitment, we're proposing $2.5 million for the next 3 years. And we wanted to get approval today, mainly because we have 6 more months into the contract and we still have to go through our control agencies to get approval. And we were hoping to have some services, so we wanted to start that contract in place.
So that proposal is declining.
Yes, it is
Got it.
declining from the previous years to match our current limit.
As it should. Okay, great. And then, so the other question I have, and this is just programmatically, and there was a slide, and I was looking up something on the internet, so I could be informed at the same time, so I may have missed it. But in terms of targeted population, I didn't see African American. You may have just highlighted a few, but I know that they are a big target from the cigarette companies, as well as Native Americans. So just wondering if there were specific, targets for those and high school students, which is a big target from the cigarette companies, and just wondering what kind of, programs or promotion of Kick It, Don't Smoke.
Yeah, So we did have a demographic slide. I don't know if we can go back, but.
Yeah, and I may have missed
It's okay.
some of those, yeah.
It might be in your packet or not, but we're happy to give it to you. For African American, we have close to 20%. At first 5 clients, and then for Native American, we have almost 1.5%. The age range, because we're looking at women of reproductive age, we can look at that because we're, we have to look at reproductive age prior to 18 years old. But the average age right now that we've had from this project is 36 years old. But noted, I think the other thing that I wanted to also answer your question in terms of promotion, that's also one of the recommendations why we're wanting to leverage our communications efforts with digital and social media. We know that we can promote the Smokers Helpline so they can engage through that with the different engagement efforts that the Smokers Helpline has. We know that that could be more intentional, and looking at the numbers, we know that we can make a better effort. And having Gordon here from TCP, we also want to be more intentional in our partnership and how collectively different state agencies unified and leveraging our resources as we work together so we can be more successful collectively together.
Can speak a little, so I think you had said it was previously, or the current funding is $3.6 million over 3 years. And now the recommendation is 2.5 over the 3 years. And you spoke a little bit to how we're gonna leverage other investments, but I guess if you could speak a little bit more to what will be different, right? We're looking at about $1 million less over that period, what we will be doing less of, intentionally less of, what might be strategically abandoning, just so we understand the difference here. And I think the other question, right, as we look at declining revenues, right, how did you land on this number? Why isn't it $1 million over 3 years?
So a couple of factors that went into place. We looked at we do know that the way KK California runs, they do proportionate billing throughout their funders, and 12% of our clients is where the budget comes and how they bill us. When we were looking at billing and invoicing currently right now, we were looking around this number, which is about the 2.5. Obviously, we still have 6 months left on the contract, on the current contract. So that was one factor, but also recognizing that the declining revenue is a clear climate. We do need to have that conversation with our partner of what those lean deliverables are, because there is things that we're gonna have to trim. There's things that we're gonna do less, and there's other things that we can maximize through other efforts that we have here in California with First 5. So we wanted to get your guys' thoughts and support and moving forward, and we're happy to report back as we become more clear in what that looks like and give a better picture. And just looking at the numbers, this is where collectively we felt comfortable moving.
I think we thought there were some opportunities in some of our existing investments that to suggest, for example, the professional outreach. Is a big area for us that it's not.
I see Commissioner Jimenez's hand was up and then maybe came down. Commissioner Jimenez, did you have a question?
Yes, thank you. I just had a question for staff, and maybe they know the full answer. So you said that there are multiple agencies that help fund this effort. And so my question was, do you know what the total amount is that's projected to be expended over the 3 years?
From the different vendors, we haven't had that. We do know that CDPH proportionally funds them 89% or close to 89%. Obviously, I don't want to put you guys on, but we've had that conversation with them. And they're going to be looking at their numbers, and then obviously how we budget and how they proportion the billing for this project is 12% for First 5 California, and I think the CDC funding is depending on different grants to help them support their evaluation. And as you know, CDC grants, they're cycles of 3 years, sometimes 5 years, and that comes and goes.
Dr. Rodriguez, I know you don't want to put them on the spot, but if you would love to respond to the California Department of Public Health, we welcome.
The budget for, court slots that they call it, probably called out, but the budget for the state of California is about, $8.5 million. And that's from the three budget sources. So, we have a new contract series on that. Currently, that's the budget level.
You might not have heard that, Commissioner Jimenez, it's $8.5 million per year, funded by 3 different agencies.
What was the million per year?
8.5.
Okay, thank you.
From Steve.
From CDBG.
The
Okay.
She wanted to correct me, so it's about the same. Our investment is about.
Okay, the total, do you mind speaking up? Because I think she was in.
Or maybe, I will walk back the microphone's over here with my.
Oh, there's a whole microphone.
Well, I think so.
Oh, yeah. So, the
Thank
CDBG
you.
investment for taking California is about $8.5 million per year. And then we have PDC funding that is, about $1.2 million. Oh, actually, maybe I can, well. You know,
Well, I actually don't have a problem with that. Yes, I just want to clarify, the CDC funding actually is totally, and it funds the aging management. Yeah,
But it supports the line. though,
it's
right?
supported by,
Yes.
but it's outside of California, but supports all of California also. It's a national service, but half of the people serve that. But for the, excuse me, for the English and Spanish one, it's funded by the CPH. So it's about 10. That's right, which currently matches the proportion.
Yeah, thank you so much, Commissioner Jimenez. Thank you. Commissioner Potts, did you come off of? Okay, any other questions or comments from the commission? Any public comment? If I could ask for a motion, and I'm gonna, read it specifically, somebody could make the following motion. I move to approve up to 2.5 million from the education and research and development accounts for the 3 years to fund a new smoking cessation contract. Somebody make that motion. Thank you so much, Commissioner Gibbons.
I'll second Jimenez.
Thank you so much, Commissioner Jimenez. Jamie, if you could do a roll call vote.
Adrian Albright,
Aye.
Katrina Hazen,
I,
Elsa Jimenez,
Aye.
Jackie Majors. Aye.
Aye.
Gordon Stone.
Aye. Thank you so much. We are moving right along. We are very late on our agenda, so I just wanted to let you know we are not going to take a break. So if you need to take a break, please take care of yourself. And we'll move on to the next item, item number 5, election of the 2024 Commission Vice Chair and Advisory Committee assignments. I will open up this item with a discussion around the Vice Chair nomination, and then defer to Jamie Hastings for the Advisory Committee assignment portion, which we need to do after we do the Vice Chair conversation. So let's do the Vice Chair. This section of the meeting is focused on nominations for the Vice Chair and assignments for the Advisory Committee. As we just said, we'll start with the Vice Chair section. And first, I would love everyone to join me in recognizing our current Vice Chair, Shannon Hazen, for remarkable work over the past year. And I don't know how long you've served on the commission, but a long time. You are OG and we are super grateful. You're, effective, accountable, and innovative, and certainly a kind person to work with. So we are super grateful, and if you could join me in a round of applause. Thank you. You can do your speeches later. Yeah. Now the nominating process. We understand that there may be several folks who are interested, who have nominations and would recommend their colleagues for the responsibility of serving as Vice Chair. So the way we're going to do this is we'll hear from each nominator and each nominee who may or may not want to accept that nomination to decide whether or not to move ahead with the nomination. accepted nominations will be voted on by commissioners, and the first nominee with a majority vote will be the vice chair. And I know that that Jamie will help me, in terms of the process. So if I could ask my fellow commissioners if they would like to make a formal nomination for a colleague to be the vice chair, please do so now.
This is Commissioner Jimenez. I would like to nominate Shayna Hazen to continue to serve as our vice chair.
Thank you so much. And I think I continue to ask if there are any other nominations.
Shayna accepts.
Oh, Shayna, do you accept?
Yes.
Okay,
Yay!
thank you so much. Are there any other nominations for this position?
This is Commissioner Paz. I think I was confused by earlier about the process, but if Shayna is willing to accept that nomination, then I would echo that. I had understood that perhaps she wasn't interested, in which case I had nominated Commissioner Jimenez, but seeing that Commissioner Jimenez nominated Commissioner, then I think it just makes sense to and Shayna's doing a fabulous job.
And I will just say, I am open to other people stepping into the role, but I see, and it looks like a no from Commissioner Jimenez. Keep serving.
We're supporting you.
Shayna, you're just getting your toes wet.
Any other nominations? Okay, thank you, Commissioner Jimenez, both for your nomination and the kind words and considering. Thank you, Commissioner Paz, for your statements. I just want to confirm with Commissioner Hazen that you do.
Yes,
are interested in this. Okay, thank you so much. Is there any other discussion from the commission?
It's on the page.
Yes. Is there any public comment? Okay, so is there a motion, and I'll read it, is there a motion to move the nomination of Shayna Hazen to serve as vice chair for the first 5 California Children and Families Commission through January 2025?
But not really, though.
Yeah.
I'll make the motion for Shayna Hazen to be the vice chair.
Thank you, Commissioner Rizzo. Thank you, Commissioner Majors. Jamie, could you call the roll?
Katie Albright,
Aye.
Shayna Hazen,
Aye.
Elsa Jimenez,
Aye.
Dorothy Majors. Aye. Vivian Velasco Paz,
Aye.
Lori Riso.
Aye.
Thank you all so much. Appreciate that. And welcome.
Congratulations. Welcome back.
Welcome back. I look forward to it. I'd like to welcome Jamie Hazen, our governance director, to present the. Oh, sorry. Jamie Hastings, governance director, to present the advisory committee assignment portion of this.
Switch to the slide. So now that we have the vice chair, we will be able to move on to advisory committee assignments. Just a quick background that these advisory committee assignments are generally approved each January, and they will continue through all of January, just as with the vice chair. At the December 14th meeting, the commission voted on having 5 committees: executive, public education, outreach, fiscal, public policy, and program and evaluation, and having 2 members on each of those committees. So the staff had originally recommended, there was 3 different options, of course, not knowing who would become vice chair, and you'll see those in the future slides, but we'll probably just point to one. It was also dependent so that it would be equitable distribution, that one commissioner didn't have too many more committee assignments than others. It was based on commissioner interest and expertise, and then also maintaining diversity of appointees, as we mentioned in December, that the advisory committee would not have more than 1 appointee from, for example, the governor's office, the speaker, the pro tem, or an ex officio. Next slide. So like I said, we had 3 options here, but our first option was that we remained with the vice chair that we had currently had, Ms. Hazen. And that's what this option shows. So executive would be, is automatically the chair and the vice chair. So Chair Albright and Vice Chair Hazen. Suggestion for public education and outreach is Vice Chair Hazen and then Commissioner Majors. Fiscal, Commissioner Jimenez and Commissioner Russo. Public policy, Chair Albright and Commissioner Velasco Paz. And program evaluation, Commissioner Majors and Commissioner Russo. It's our recommendation. You can flip through those, Simon, if you want again.
Just stay on the
Third,
that's recommendation.
option, so. So with that, I'll turn it over back to the chair to facilitate the discussion on the staff recommendation.
Thank you so much, appreciate it. So this is based on a survey, we filled out a survey indicating what our areas of interest were. And the team pulled together the matrices based on this. We are grateful. I know that's a lot of work to put us all in the right places. Does anyone have any feedback, comments, concerns, questions?
Or requested changes?
And some of this is based on things that we've done in the past, so that it continues our focus area and relationships going forward. Does anyone want to be on a different committee than they were? Okay, seeing none. Okay, are there any,
Oh, I was just gonna make a motion to approve.
before you do, let me just see if there's public comment. Seeing no public comment.
Yes, I'd like to make a motion to approve the committees as outlined in option one.
Terrific. Is there a motion?
I'll second.
Thank you so
Commissioner
much.
Jimenez, second.
Thank you so much. Jamie, could you follow?
Katie Albright,
Aye.
Jada Hazen,
Aye.
Elsa Jimenez,
Sorry, aye.
Becky Majors. Aye. Vivian Velasco Paz.
Aye.
Lori Russo. Aye. Thank you.
Thank you so much. The motion carries unanimously. We are grateful. So we are now into the information section of our agenda. We're going to move to item 4, the financial update. And then I promise we'll get to public comment and our regular agenda. I would like to welcome Marcia Thomas, our fiscal services officer administration, to present the financial update. And also just express huge gratitude. I know this was a lot of numbers and crunching in a short period of time, and I'm looking forward to this report and other time as well.
And Ms. Thomas is presenting from her office, just in case she has to pull up some of the charts that you need to zoom in. If there are any questions.
Okay, welcome. We'll turn it over to you, Ms. Thomas.
Okay, let me pull it up. Oh, okay. So Simon, I think you're sharing, so you can go ahead if you want to.
Yep, I got you.
Okay. All right, so, hello, everybody. Good afternoon. Go ahead and skip to the next slide, Simon. So I wanted to start off the fiscal presentation. We presented this slide last time, but just to kind of revisit it. This slide represents the flow and the direction of the tax revenues to First Five California. And so it's showing you that CDTFA collects the taxes. They deposit it into the account. They make adjustments to the revenue. The adjustments can be for the statewide assessments, for refunds that they have to give back to the taxpayers. It could be, you call it their administrative costs. Once they figure out all the adjustments and they deduct it from the revenue, then it gets transferred into the First Five California accounts. So automatically 80% will go into the county fund, and then 20% will go into the First Five California accounts. In addition to the 80% of funds that go directly to the counties, First Five California also disperses funds to counties participating in programs that are developed by First Five California in support of the North Star and Audacious Goal. Next slide, Simon. So this is the revenue projections that we received upon release of the governor's budget. We got this earlier this week. So what this is showing is the multi-year projections. The next slide is going to show what goes into the projections. But for this one, the blue one is showing you what we received in May of 2023 versus the orange, which is the ones that we currently received. So what goes into those revenue projections will be the next slide. So we get the projections from the Department of Finance for the cigarette and other tobacco products. We also get it for the Prop 56 backfill to Proposition 10. And then we get the CSET tax, the California Electronic Cigarette Excise Tax. So that's new that we got this year. We also take into account the estimated revenue that the California Children and Family Trust Fund could receive. So all of our accounts, just to put it out there, are interest-bearing accounts. So through the pooled money investment account, the state treasurer invests funds determined to be in excess of immediate needs. So all earnings that are derived from those investments are apportioned to the contributing funds as provided in government code. So the rate of interest changes regularly and it gets posted to the accounts quarterly. And then there is backfill. We minus the backfill for the Proposition 99 and the Breast Cancer Fund. So that's pursuant to Health and Safety Code 130105. CDTFA actually determines those amounts to be transferred to those two funds. And then, once it's deducted, it's usually annually that it'll be taken out about January, February. Then they transfer the revenue over. Let's see. So this is an offset, or to offset the decrease in revenues resulting from consumption changes triggered by Proposition 10. So then the next one is the statewide assessment. This is primarily the pro rata that gets pulled from the account. First Five is a special fund. So the pro rata assessments is the special fund's fair share of the statewide administrative costs. So these costs are transferred to the general fund since the general fund pays for the costs up front. And then you have minus the administrative costs for CDTFA. So they collect the revenues and they determine the amounts prior to transferring the revenues. Historically, they used to do it kind of in big proportion. They would deduct it from the revenue before transferring. They now take what they estimate to be their cost for the year and they divide it out by the 11 months. So it's a little bit more even when it's deducted. And then after we take out all of those adjustments, then that would be the estimated amount that we're expecting to transfer, with 80% going over to the counties and the 20% for the state commission. And then next slide. And this is just a picture. It was kind of shared in the annual report as well. This is just kind of a different presentation, but it's the statutory distribution. So the 80% and then the 20%. The 20% will break down what portion statutorily gets distributed to the mass media, education, childcare account, research and development, unallocated, and our administration. And the next slide. Okay, and this slide is just focused on the Proposition 10 revenues. It's not including the Proposition 56 backfill, not including the CSET, the interest. It's just strictly the Prop 10 that's coming monthly from CDTFA. It's basically showing the volatility from month to month. There's different factors that play into, the dips every month. So for this fiscal year is in yellow, and we're counting from July to November. So for the first 5 months of this fiscal year, it's a little bit lower than the previous year. But again, it's just focused strictly on the Proposition 10. It's not encompassing anything else. So Proposition 56 backfill will normally backfill that and bring it up a little bit more. That usually gets transferred annually as well, and that comes about January and February as well. Let's see. Okay, okay, and then the CSET tax, operated a little bit weird last year. It started in July 1st of 2022. They were a little bit late to get transferred over, so we basically got it towards the end of the fiscal year. It is actually transferred quarterly, so we just got the first quarterly payment not that long ago. So it would be from July to October. And then okay, I think I got everything on that one. So the next slide, please. And this is just showing you the Proposition 56 backfill. So it's just a 4-year picture of what gets backfilled to Proposition 10 and then what Proposition 10 backfills to the Proposition 99 and Breast Cancer Fund. Last year we got 84.7 million for Proposition 56 backfill to Proposition 10. And 9.4 million was backfilled to the other funds. So again, the backfill to the Proposition 99 and the Breast Cancer Fund is actually deducted by CDTFA prior to transfer. Proposition 56 backfill, just a little bit of history, was approved by voters back in November of 2016, increasing the state's excise tax on cigarettes and other tobacco products. So the backfill was intended to maintain the loss of revenues to existing tobacco tax funds as a result of the decline in purchase and consumption. And then for the 99, the breast cancer, that's pursuant again to Health and Safety Code 130105. Next slide.
Marsha, can I just clarify that, just so
Yeah.
people know? Yes, what we're trying to highlight is, yes, Prop 10 is declining, and you saw it in the item, by 14%, but between the backfill and our advocacy to get the CSET and the cartridges, right, which is where the money is at in vaping, is that we actually decreased that 14% to, we estimate, about 4% decrease. Right, so yes, we can talk Prop 10, but it's also really important to understand Prop 56 and this new revenue source of CSET advocacy that has closed, not entirely, but has closed that gap.
Sorry, thank you.
No, that's okay. I was gonna get there.
Oh,
That's okay.
Letter.
Now we're on the budget ladder. All right, so as some may have heard, there was a budget letter that was released in December. It was released or it was communicating a current year expenditure reduction effective immediately. It encouraged state departments to take measures to ensure more prudent spending given the fiscal outlook. There was various things to kind of look out for or to reduce. I just captured a couple of them. But due to our own declining revenue stream, this is a practice that we already have in place as we review all the expenditures to ensure operational savings. Our administration account has felt the strain of declining revenues and increased costs over the years. And so we continue to work through those challenges of bringing the two into a closer alignment. So the next slide is our administration account. And I just captured the projected expenditures and the projected revenues for the current year and then the 4-year out. And so it kind of shows you that we're in good shape until 27, 28. That could change. Our current budget is still capturing like rent and like other things that we kind of are still looking and discussing as far as like cutting back on. So it's kind of a high estimation at this point, but it'll be adjusted probably by May revise. And then the next slide.
And Marsha, of note is that we didn't capture interest in that, so because it's just pure revenue versus our expenditure.
Yeah, it's just strictly the Proposition 10 in the backfill and all that. It's not. So everything that you kind of saw in the second slide where I show the projections and that amount, that's kind of capturing that, but not the interest revenue. So you're correct, Jackie. So the attachments that you have is the funding structure overview, attachment A. You also have the financial plan, attachment B, and then you have a fund condition summary, which is attachment C, that shows you the investments. The financial plan is a little bit higher level. Next slide. So how do the projections tie into the financial plan? So I just kind of wanted to go over that. I know sometimes there's questions on what those boxes actually mean. So just since we're talking about the projections, I just wanted to walk through it really quickly. So the total prior year carryover is basically the amounts that are the ending balance on the financial plan. It's just carrying over altogether. The total revenue goes back to the projections page as well that we shared earlier. It's just capturing the Proposition 10, 56, CSET. The interest is captured separately. And so that we just make a projection as far as what we feel like it's going to be. The last fiscal year, it kind of ran high. This fiscal year, it's also running high as well. But we kind of made an adjustment to show that it could drop next year. And I'm sorry, you guys should have the financial plan. I should have asked prior to me jumping into this, but I think you guys have a copy of the financial plan in front of you.
Yes, we do.
Okay, yeah, so this is at the bottom. That's what I'm kind of going over is the boxes at the very bottom. Sorry about that. And so the interest is captured separately. The total federal kit reimbursement, it's usually about $500,000 a year that we estimate coming in. We work with CDPH and kind of estimate what it's going to be. So this fiscal year, they said it would probably run a little bit higher to 593,000. So once they give us that amount, that's what we'll put in there. If it's unknown, we keep it at 500,000 as we move forward. And so the carryover, the revenue, interest, federal kit reimbursement, that's all going to be your total resources for the fiscal year. And then we would subtract out the committed and under consideration expenditures, which would leave you a balance, whether it's total over or under, but that's your balance. We take the 15% reserve from the total revenue. So it's not capturing the interest or anything else. It's just capturing the revenue from Prop 10, CSET, and the Prop 56 backfill. And so that will give us our net reserve. So as far as the 15% reserve, again, that's just taken from the revenue, excluding the interest. It does not carry over to the next fiscal year. As we enter into the new fiscal year, we release that balance and then we look at the current year's estimated revenue and then we'll assess the 15%. So it's not carried over. And then the net reserve would be what we start our fiscal year with. So we're continuously appropriated, which means our funding just rolls forward. To encumber funds or set aside funds for current commitments or obligations of the state commission, we have to have sufficient carryover cash balance to cover the costs or projected current revenue that would ensure sufficient cash in the given year to cover the obligation. So the commission enters into multi-year agreements with vendors and county commissions, typically in periods of 3 years. However, the encumbrances for the agreements only include unpaid and remaining commitments for the current fiscal year. It's not the entire agreement amount. Therefore, the funds that must be available in the current fiscal year obligations, or there must be funds available for current fiscal year obligations on July 1st of every year. Does anybody have any questions on that? No?
Any at this time?
Okay, well, that's actually my last slide, I believe. Go, can you, there you go. Yeah, so if you have any questions, I know I kind of ran through it a little bit fast.
That was super helpful and very informative. Appreciate it.
You're welcome.
Anyone on this commission? Yes.
I'm wondering, so as we look at actually the last slide or the bottom of the financial plan, we look at the next 5 years, there seems to be, well, I guess, are we expecting to see a leveling off by 28, 29 in terms of the decrease? It looks like it starts to get to about $2 million less a year. I'm wondering, do you expect any kind of leveling off in the next 5-6 years?
Marsha, I can take that if you want.
Yeah, if you want to, that's fine.
So these numbers are based off of finances leveling off. So you'll see year over year, the first year is about 4%, and the leveling off goes about 2.7%. from 24, 25, 25, 26, 26, and so on and so forth. So there is a leveling, but there's also kind of the backfill situation. So we don't know. We received the data from finance and from our, but based on that, it looks like it's leveling off, kind of closing that gap. And those 5 years do account for this labor ban already. If that's, because I know that that's also top of mind for folks, is that finance has considered a full year of impact of the labor ban. And so it's still decreasing, mind you, it's still decreasing.
Yeah, but it's a more steady.
Good job, pick at California, or,
Okay.
but yeah, but there is a leveling off, as projected by finance, if you were to read this.
Got it. That's super helpful. And then I'm wondering on the same document, the projected interest, I noticed, so from 24, 25, all the way through 27, 28 is the same all the way across those years. And I'm wondering if you can explain why.
That's just how we forecast it, because we just don't know what it's going to be, so we just carry it all the way forward. As the year like progresses and we can kind of get an idea what it is, we'll adjust it a little bit, but for the most part, when we're doing the initial projections, we just carry it forward.
So it's not a set percent of revenues for that year. Like we don't.
No, because we just don't know what it's gonna be, because it's based off whatever is in our fund balance at the time that gets invested. So it fluctuates so much. So we don't have like a good picture of what it would be.
Marsha, it'd be helpful to share with the commission what you shared with me about the governor's even, kind of perspective on interest, kind of I think you may have said it earlier, maybe I made it up in my head, it was in your office. If you don't recall, I can share and you can correct me when I'm wrong.
Well, I can barely hear you, unfortunately, but I know you said something about interest, but if you want to share.
Okay, I will project. So I in our conversations, and you will correct me if I'm wrong, is that this year was abnormally high because the investments, different kind of investments that they were making as a bank, the SEO, whatnot. And so to be conservative, we're not sure if that type level of interest will be yielded again. And so we just conservatively just cut it in half. Because the indication was that the interest itself was, I shouldn't say abnormal, it was unusually high these last couple of years.
Yeah, that's correct.
Good job, I get an A. I'll give myself an A.
Thank you so much. Any other questions or comments from the commission?
This is Commissioner Jimenez. I just have a comment and a note of appreciation to the team for really looking at our administrative budget and identifying costs that could be allocated to other specific areas. And, we're at a point where hopefully we're getting to a point where our expenditures are going to equal to the declining revenue or projected revenue amounts. And so it's like a huge lift off of our weight off of our shoulders, I think, in terms of just, where we were before we kind of right-sized our expenses and truly only keeping those expenses that are administrative in nature and moving everything else to the other program areas. So thank you, team, because I know that that's been a journey that we've been on for a little over a year, if not longer.
Thank you. Thank you for your support and guidance on that as well.
Thank you, Commissioner. Thank you, Ms. Thomas. Any other Commissioner Paz, any other comments, questions?
Yeah, I also want to actually be grateful to the county who helped us kind of redefine our administration to help us actually close that kind of spending gap, if you will. So we know there's lots of different ways, but actually gave us kind of a sense of how people were allocating their administration. So that was helpful and gave us, if I were to say, more courage with legal backing to make those.
Thank you so much. Is there any public comment on this item? We're about to open it up for public comment generally, but any public comment specifically on this item? I see, is that Jamie, is that your hand up? Or is that's just like the first 5 minutes? Okay. That's enough. That's cool. Okay, thank you very much. Ms. Thomas, on this particular item, I think we're all very focused on our finances, so we look forward to continuing our partnership with you and updates as we both understand what revenue projections are, and how we can work together on them. But thank you very much. Appreciate it.
You're welcome. Thank you.
To get here. So we're gonna continue to take our agenda out of order. I want to make sure that we have adequate time for all the agenda items. So we're gonna go to public comment, and then we're going to go to partner, and then we're gonna honor people's time. And then we're gonna honor people that are here. We'll do the partner presentation, as well as the First Five Association. We'll do commissioner comments and executive director report. So, and hopefully gain some time here. Our last item on the agenda will be the small population county funding augmentation. And we are going to table for now the fatherhood initiative, and look forward to that presentation at our next meeting. I think I did take public comment. Any member of the public on the financial update? Okay, great. So we're going now to item number 2, public comment information. Members of the public, this is sort of general public comment. Members of the public may speak up to 3 minutes on any non-agenda item or items not related to pending judicial, administrative litigation or personnel matters. No action by the state commission may be taken on this public comment. If you wish to comment, use the raise hand function, either virtually or in the room. And Jamie will call on public in the order in which they've signed up, starting with those in the room, and then the virtual view. I know many people are here for agenda items, but want to make sure that there is no other public comment. And Jamie, is there any on the? Okay, thank you so much. Public comment is now closed. Okay, thank you very much. We are going to open it up. I'll defer to Jackie. Love to get the opening of what's going on in First Five Sacramento.
So Rita, if you wait a little, if you guys wouldn't mind switching up, because I think the mic's closer here for those who are actually, I apologize. I don't think I you hiding. I apologize. If you are together.
Julie, I'll go. Are you guys ready? I sort of took things out. Oh, okay. I just ran it.
Yeah,
Okay.
so perfect. We're having to do a little music sharing.
Okay.
Because thank you.
Well, and then we'll bring it back on I know.
Is that
The other way.
the other one?
The other one first.
Can I get someone from your group to help me with that? I've got a lot. So could someone just let me know which slide that is?
And perspective. I guess.
One second, Annie. Reset to your slide deck. You reset your slide deck.
Sorry for that. It's
All good.
Very interesting. Law on the purpose.
We took a lot of order, and we, except on.
have that one.
Seems to be doing it, so.
Yeah.
That would have, that would have.
Yeah, thanks so much.
We look forward to opportunity.
We look forward for you just.
Oh. yeah, that's all yours. Yeah, I think that's what. Sure, okay. Great. I'll just have a portfolio first, then the- Oh, okay, sorry, gave it to you, I took my back. Okay. Hello, commissioners, glad to see you in person, and welcome to Sacramento. You've been here before. This is, definitely the shortest commute I've ever had to a commission meeting. I don't know if you know, our offices are, I could have skipped here. Our offices are just right up the street. So close that I even have a couple of my first time Sacramento staff, crashing the party today. But thank you for, allowing us a little bit of time on the agenda to talk about our region. I've asked, two fellow commissioners in the region, Kathy Guerrero with First Light El Dorado, and Janice LaRue with First Light Packer are here to jump in on a couple of the slides and just give some updates. So next slide. So we affectionately call ourselves the Wolf Pack, which started back in, I think 2017. We bonded, one more back. Sorry, you got it. There you go. We bonded at a First Five Association meeting. We've been, First Five California assigned us into regions, as you know, I think back in the year 2000. But our region really sort of solidified about 10 years ago, and we came up with the name of the Sacred Wolf Pack. These are the counties in Sacramento region, and we have an honorary member of Merced. They're a little rebellious in Merced and joined us probably also about a decade ago. And we learned so much from each other and really value the diversity of our region. Next slide, please. So I wanted to just talk a little bit about what makes us so unique. Our county size is very different. We have Sacramento, which is our largest county in the region. We have close to 19,000 births here per year, all the way down to Little Colusa County, which has, I think, 246 births. And our geography, we have mountains, we have the valley, we have foothills, a lot of agri land, so very diverse communities, even living within those different geographic areas. Politics, we have YOLO, which leans very much to the Democratic side, and then we have Placer, which leans very much the other direction. So we've got a little bit of everything. And our families look different in different counties as well. El Dorado has primarily Caucasians, 76% Caucasian in El Dorado, and Yuba, Colusa having 61% Latino families. And then Sacramento with the highest population of African-American families in our region. So one more, because I just think it's so interesting. Placer being the wealthiest county with a household median income of over $93,000 per family, and Yuba, our poorest county, at a household median income of under $60,000. So yeah, just a lot of diversity, which really makes us stronger as a region. We have wonderful partnerships. We really pull on each other's strengths. We have been able to use those strengths to leverage dollars, leverage trainings, leverage consultants, leverage a lot of stuff. Our strategic plans are very different. In Sacramento, we really focus heavily on racial equity work. El Dorado looks primarily at systems change and systems investments. Placer, maternal and early child mental health is a huge priority. Stanislaus has a robust family resource center network, and YOLO also is effective systems transfer. So a lot of systems work happening there.
So the families, the strategies, and the funding looks different in every county, but all of our diversity, we really see it as a great connection to help First Five California advance your own North Star around equity. We know that one size does not fit all, and that we just really value the way Proposition 10 was written to allow us all to excel and to create very specific plans in our counties. Okay, next slide. One of the other direction. There we go. One of the programs that I'll talk about before handing it over to my colleagues is our Refugee Family Support Program. This is one of our newer launched programs, and this partnership has been incredible. 4 of our 9 counties have refugee family support funding in 2 different grants. It has allowed us to do things like shared listening sessions across all the counties, because our families cross the counties. We are able to share trainings, car seat trainings, of just a lot, bringing a lot of different resources. What this grant has really done in Sacramento that I just wanted to speak to, and you'll hear a lot from Mr. Usama Khalil in a moment, one of our funded partners for Refugee Family Support Program. The money has allowed us to do twofold. We were really able to look at systems, the system of services for refugee families, and bring these 5 agencies that didn't necessarily always work together. In some cases, we brought in new agencies in the 5 that had never been in the room together before. And we talked about developing a system for referrals. One of them focuses heavily on mental health, another one on education, educational workshops for parents new to the country. Many focus on basic needs, but having everybody in the room, everybody talking to each other, building the rapport and the relationship necessary to feel really comfortable and trusting and handing clients out of their door and giving a warm handoff has been one of the biggest successes of this program. You'll see the statistics on there of, we provided, they provided many over 1,000 basic needs, navigation services, maternal health assessments, and educational workshops. And families, we have an intake and then a post-test or a post-check follow-up. Families really do feel supported by those programs, and that it has reduced their stress and connected them to other services that they needed. I will let Janice wanted to talk just briefly about the YOLO, Placer, and Sutter outcomes.
Sure. So Sacramento is the largest refugee serving county in the state. And we in Placer, I wasn't even gonna apply for this grant, but 2 nonprofits in my county said, when they heard about it, they said, Janice, are you gonna apply for this? We really need it. I was like, you do? And so I reached out to my colleagues in the Sacramento region. I said, is this an issue for anybody else? And Gina and YOLO said, yes, but I don't have the bandwidth to do a grant. And Michelle Blake and Sutter said, yes, but I don't have the bandwidth to do the grant. So I said, well, I'll be the lead to do a kind of wrap around Sacramento, because we're seeing an overflow from Sacramento in our counties. And so that's how it worked. We decided to write a grant to provide resources for the counties just outside of the Sacramento region. Placer, and I think that's somewhat the way in Sutter, is uniquely unable naturally to deal with refugees. It is, as we had said, a pretty white, wealthy, affluent county. We don't even have a consolidated transportation system. It would take me 3 hours to get from my office to my home if I took the bus, because I had to go through so many transfers. It's the system itself is not set up to accommodate people who don't speak English, who don't have a car, right? And so we found ways to work, first of all, with our colleagues in Sacramento, having sharing. Julie was really helpful in sharing the resources and the
planning for her grant with us, and to have the link with Sacramento was extremely healthy and then helpful, and then to share learnings between the counties was really helpful. We really established for the first time a relationship with our CalWorks office, with our public health to help, and our Office of Ed, which we're really pretty integrated with anybody, to help us establish a system for addressing refugees. It really moved to our Office of Ed, for example, to recruit, because we started to see data, we need more Dari speakers. That was one of our largest needs in the community. So it helped them recruit providers who could serve the Afghani community. It was extraordinarily helpful. So we only thought we would serve about maybe 50 families. We ended up serving just to the end of the year. We're still going 81 families, 297 individuals, 30% of them were children 0 to 5. As we said, the regional and local collaboration were so instrumental to the success of the project. One quote from a provider, we had an English language pilot, which was extraordinary in Yolo County, where they went into an apartment complex where Afghani women were. It was one that was addressed specifically to women. And it was a project that was designed with really culturally competent methods. The person leading the instruction was a woman, because culturally that was what was appropriate, and understood that some women couldn't read at all, they couldn't write at all. And so they approached literacy with a very open mind and very respectful of cultural norms and abilities at all levels. And of those that were involved in that English class, 80% of families completing it said that they felt more comfortable speaking English and were better able to meet their own needs and those of their children after the lessons. It was an extraordinarily successful intervention that was really pivotal and important in terms of newcomer resettlement in the particular communities. And so I think that that's probably the most significant aspect of this, is it really helped us to hone our cultural adaptation to communities that were truly to communities that were truly to our counties very new, and accommodating our systems to embrace the newcomers.
So on the next slide, I guess I get to go. Yes, you do. I'm Kathleen Burrow, and I'm the executive director for First Five Eldorado, and I get to share with you some of our work around impact and the homeless work. Region 3 impacts first started with the Sacramento region, the slide that Julie had shown you. And when we were first granted the funding 8 years ago, the neighbors said, "Hey, could we play?" And so we were joined by 5 additional counties, 2 of which are here in Nevada and Amador here, who said, "Yeah, we'd love to be with you and leverage the work that you're doing." And then just this last year, we brought on the Tribal Child Care Association. So we have 14 contracts, or 14 counties, and then the Tribal Child Care Association in our contract. The work has been led by our First Five, but we have not done this alone. A very, very strong partnership with our County Office of Education, who has helped us to facilitate what I think is a very strong network for high quality early care and education services in the region. Our regional objective is really to create an economy of scale. We focus on capacity building and sustainability. And I think if you were to ask the smaller counties that joined the other 5, it was because they were smaller and we were larger. We were a well-oiled machine, and we could leverage resources and work together and really share the knowledge and the leadership that we have in the region. Our approach is very simple. Have clear communication, meet regularly, create an environment of trust and respect, learn, listen, and be responsive, share resources, and innovate. Our successes are listed on the slide, but I thought I'd share with you a few stories of the accomplishments that we've had over the years. We have communities of practice that get together specifically around both equity and family engagement and coaching. Our family engagement one came together and said, how are we reaching families earlier? How are we getting out in front of them? What could we do differently? And we found that a lot of folks had similar family engagement strategies, but they were not aligned. And many of them had kits or enticements or play groups that they had done together. And what we did is we came up with a collaborative outreach strategy where we said, hey, what if we use these kits, many of which based on Amador County's work, our Little County's work, and said, hey, they're great. They're in a brown bag and they're coloring and they have activities and we can use them together. And what we did was we collectively agreed upon the 12 months worth of work and then did some bulk buying. So it was affordable for the smaller counties to join in who may not have been able to have those in the past. We also launched this year a professional development county organizing all of the training and professional development opportunities in early care and education. If you've ever seen those, they're large and they're not organized well. They put them together, state, regional, and local. And just recently, they've had over 56 regional training events across the quality and different topics. And this has increased access to both English and Spanish speaking trainings and reduced costs for local counties who may not have been able to join. But if you have the goal for the number, more folks can join. We've also piloted the coaching companion system that's now used across the state. It's an integrated state developed resources for inclusion, full strategies, and coaching competencies. El Dorado County State Coaching Companion Coach contract for the state in this. And lastly, I wanted to mention our regional system. We as a region negotiated one of the first contracts to figure out how are we going to have collective data. And when the costs came in, the region said, hey, you know, Sacramento County's costs are this and the smaller counties are this. But what if the smaller counties can afford this in the long run? And what we decided to do was rather than have each county or consortium put individually, the region actually negotiates that contract and pays the contract for all the counties so that the smaller counties have access to the same quality of data systems that the rest of them do. So we're really proud of our collaboration and our willingness to learn in that contract. On the next slide, we'll talk a little bit about home visitation. This is new, the new contract that all of you have had. It is actually led by Sacramento County, but Julie's given me the ability to talk a little bit about that. It's a little bit different. We have 10 counties that have been meeting since February 2023, and Sacramento County is the lead. We have two primary strategies. The first one is to develop a workforce and development plan. So the region has successfully negotiated in kind a contract with Early Start. It's valued at nearly $100,000 that they're coming to bring their expertise. And we're going to be exploring the workforce across all of the 10 counties, doing both surveys and focus groups to find out what's really happening in our home visitation workforce. From what they've learned, they're going to develop some training and technical assistance strategies, and then next year we'll implement strategies. And in a separate contract, we are looking at doing some parent leadership work, parenting caregiver leadership. So we're working with an organization called Lead, and they have come to each one of our counties to talk about how we can start doing a parent partnership plan. There's an online portal where there are 10 modules where parents can log on and learn. And what we'll be doing is having a cohort meet after the learning to talk through and build parents' confidence in engaging in challenging conversations, in lifting up their voices from the community. The goal is that this spring, each county will have a cohort of parents. It will be engaging in the work online, and then we'll meet regionally to reflect. And then as an aside, or in our ongoing commitment to learning, we are engaging in the Medi-Cal Learning series. This is a bi-monthly series where they have different topics. I think the first two that they've done is Medi-Cal for early childhood leaders, and then leading and managed care data. So we will continue to learn and grow, and I'm confident with the lessons learned from our impact region that they will continue to spill over into our participation work, and that we will innovate to great things as well.
I think that's it for the bulk of our presentation until we hear from our partners at RITA. You know, we're in this now 25 years that we're celebrating the first five movement and the network that exists between the counties and the association, and of course, First Five California, where together we share a mission and work together to advocate for children and families. And it's not just about funding, it is all about advocacy. Our proximity to Sacramento makes us really good in terms of advocacy for the state. There are many times when, for example, here with our colleague from RITA, we've been able to go to the state, lobby the state, present families and children to talk about the importance of investments in children and families. And so as we move forward, we look to a strong connection with the state commission and a unified voice to support children. So thank you very much. So
Thank you for the great partnership. And sorry.
I think you're up, sir.
Madam Chair, honor commission members. Guests, my name is Usama Khalil. I'm the founder and chairman and CEO for the REDA organization. REDA is actually a Refugee Enrichment and Development Association, and the pronunciation of the word REDA in Arabic language means satisfaction. And my last name Khalil means in Arabic best friends. My objective to share with you today is actually 3 points. Number one, the criticality and urgency, why these particular population are in need of collective effort to integrate into their new lives here. So I'm going to share with you some challenges, and those are examples, not for easy, to give you a glimpse of what kind of lifestyle that they face every day. And also the second objective is I'm going to share with you some of the programs that we developed that actually help them to survive and to go along with their process of integration. And finally, last but not least, is to show you the efforts that the program of First Five, when we get engaged last year, that was significant addition to enable us to add more programs, and you will see how that was effective with that additional number of service staff. I know I have very limited time, but I will try to be extremely fast as much as I can. So please stop. Next, this is just a glimpse of the origination of the organization. We started back in 2017, and I had just $2,000 donation where I started the organization with. And we were 100% volunteers. Between 17 and 20, we all have been also volunteers, and in 2020, we just had the first phase staff. And one program since 17 until 2020 that we're focused on, which is the case management. Last couple of years, actually, we grew significantly. Now today, we have 23 paid staff, 13 active grants, and we have totaling in grants funding about $3.8 million, and we have 10 programs instead of just one. Next, please. So I'm going to share with you now, first, coming a few slides, the challenges and what is the need for them on the short and long term. Next, please. The first challenge from day one when they arrive, they come with those challenges that they face themselves facing them. Language barrier, insufficient income, lack of appropriate work skills, monthly budget deficit, and disabled heads of household, larger number of children, and limited means of transportation, and ignorance of the U.S. living system. And I just want to make a quick big distinction between refugee and immigrants, because immigrants, I'm immigrant myself, but we came by choice. We knew that we were going to face some challenge in the beginning, but we chose to face that challenge. But refugees, they had stable life back home. Most of them has sufficient living, but they found themselves forced to be in that condition. So that's why we have to, they need the additional help from society.
Go ahead, sorry.
After they spend about 2-3 years living here, they develop a whole host of new challenges that they would never expect to have. Next, please. These challenges are husband-wife conflicts, parent-teenager conflicts, domestic violence, increase in single mom households, anxiety from financial insecurity, children academic failure, increased violation of regulation of the law of the land, and risk of homelessness. And those because they continue having challenges every day, so they result in facing those additional challenges down the road. Academic failure of the children, they place their teenagers, middle and high school by age, not by academic competency, so they end up to drop from high school on high rate. Next, please. So we determined the short-term need and long-term. Short-term needs from day one, they need financial support and they need language support and they need transportation, they need household items, they need food assistance, and they need case management, and they need educational workshops for the US learning system. Next, please. On the long term, they need a car for transportation, they need English language assistance, and they need training for enhancing their work skills, and they need job placement. They need support with the healthcare system here, which is so challenging, dealing with insurance and medical, and they need cultural educational for integration, and also, most importantly, they need psychological and emotional support. Next, please. This is actually the mission after the 90 days of initial resettlement for those families where they have extensive support from the settlement agency. Our objective is to have them to achieve self-sufficiency. But in order to achieve that, it's a long journey that requires extensive, effective collaboration between state, counties, cities, and communities to help and assist them. So what we did, we developed along that journey the essential programs that help them to achieve into the objective of the self-sufficiency. Next, please. We have two major categories of programs that we developed, social services and educational and youth services. Next, please. The social services, we have case management, which is the core function, and mental health screening and resettlement. In the last 2 years, as you know, that there was the evacuee situation that happened in 21. So the federal government issued an APA program, Van Placement and Assistance. So we were part of that program. And then emergency fund for helping financially and recreation. And I will close our presentation today with a very fun recreation outcome that I will share with you. Recreation will take them into ocean sites and natural to see the beauty of California to compensate the health condition that they face. Next, please. In the education, we developed English language lab. The objective of that lab is to focus on helping them learn conversational English rather than the traditional teaching of English. We have a state-of-the-art English lab that focus on that. And we have school tutoring program where last year we received an award from San Juan School District of most valuable partner because they told us first time ever in history of the district, they see a refugee students in high school receive GPA of 4.0. Those were 3 students attended our tutoring center. After 6 months, they achieved that objective. Of course, they are gifted the students, but we helped to bring that gem inside them outside because they were afraid. And the youth mentoring, where we actually partner with UC Davis, School of Faculty of Political Science, and also School of Medicine, where we have students coming to mentor the high schooler how to choose their future academic path and how to select their career. And also we have a cultural orientation workshops ongoing. And our newest program we are still working on right now is bilingual Montessori preschool. This to serve the young parents who have young children to actually bring them in, and then the parents can attend the English and attend the workshops safely. Next, please. Last year also, RETA became a central hub for the Sacramento County, where we received incoming requests for help for refugees to support all the settlement agencies, IRC, Opening Doors, World Relief, La Family, and also school districts and community at large. When they encounter the special need for refugees, they come to us and then we make assessment and identify the every need. And then we provide those, make referrals to each of the organizations locally who are culturally sensitive, can provide that particular service for them. Like legal services, like counseling, like job placement, like food support and clinical and so forth. Those are culturally sensitive organizations. Next, please. Over the years, next please. In the first 4 years, we actually provided over 5,000 assistance for the refugee. Next, please. And last in 21, we just 21 was 1,100. Next, please. And 22 was double that. And 23, next please, was almost 5,000.
And thanks for the addition of the grants and the First Five program that which has enabled us to increase our programs as well. Next, please. As you see in this chart here, 54% of our services last year in 23, it was actually for the case management, which is a critical function. And we are the top provider of case management in Sacramento region here. And the second in the row was First Five programs, 18% of our services that we provide since last year. Next, please. And this here, all the service we provide through the First Five programs from September 1st, 22 until 2 days ago. Basic needs, we serve 806. Navigation, 776 assistance. Mental health assessment for 227 families. And educational workshops attendees, 118. And language support, 103, and therapy mental health support for 33 who receive the counseling and referrals for assistance. Next, please. Our countries and language that we serve refugees coming from Afghanistan, Egypt, Iraq, Jordan, Pakistan, Palestine, Sudan, Syria, and Ukraine. And language that we support are Arabic, English, Dari, Farsi, Pashto, Russian. We actually, the staff that we have today, half of it are refugees who are case managers. And for the English language lab that we have, the program manager, he is a PhD who was the dean of foreign language faculty back in Barbani University in Afghanistan. And he is leading that program with us today. Next, please. This is the thank you for all of you for having me to share this information with you. Now, this was one of our camps that we took Arabic-speaking families. We have two ones, one for the Arabic-speaking, one for the Afghani. We take them in the morning. It was at San Francisco in Point Reyes camping area. So we took them at the sun rising in the morning to see the ocean. Let me tell you, most of them, first time ever in their life to see an ocean, let alone to see this wonderful opportunity of a baby whale that was pushed to the shore, and they were able to touch it. And it was an extremely important experience for all.
Was okay.
Was it alive? Sorry? Well, unfortunately, it was alive. It was alive when we saw it in the morning, when we came, and we called the authority of the beach. But they came very late. They came in the afternoon, and he was died already.
Oh my God.
But most of those families stayed 3 hours in the morning. Didn't want to go back to the camp. They want to make sure that someone will come to save them. It was very emotional experience for them. And I thank you so much for giving me the opportunity to share this information.
Thank you so much for your work and for the family.
Thank you.
Any questions?
No, but given the, the time limits that we have, I just want to say this. I really appreciate how you all are collaborating, because if we don't collaborate, we're not going to go anywhere. Funding is declining everywhere and the families need resources, but the 3 areas that you highlighted, and I have several partnerships like this, depend on relationships, as you guys said, you meet often, shared data, which is so critical, and shifting leadership, which I think was something a little newer that people don't think about, is that you guys really are shifting leadership based on who has the capacity, the passion, or whatever. So I just want to applaud you.
Thank you, Commissioner Mason.
I wanted to lift it up.
You
We're
may
all
have spoken-
sad about the baby whale.
You may have spoken for all of us in your comments, but let me just check anything. Commissioner. Thank you so much.
One quick thing, along the lines of, the refugee work, and really appreciate all the work you're doing. But I'm curious, and maybe this is for another day, but if there's any federal advocacy going along with this work, it feels, we've come in and are filling in gaps that exist, that I think should be, covered through Office of Refugee Resettlement. So I'm curious if we're identifying some of those things that we can look at for federal advocacy. And then just a clarifying question, so you described the work you do with refugees. Are you serving, maybe collectively, are we serving asylum seekers as well, or is it only people who have been identified as refugees?
Well, we as an organization, we serve everyone, all immigrants and all asylum seekers and all refugees. But with the focus with the program for the first 5 is focusing on refugee families. Not asylum seekers.
Thank you.
One thing about that, so that is really a great question, because our agencies do have to turn back folks, turn them down because of the narrow, prescribed, target audience for this. But, we know that you all are considering future funding of this. There would be, an original ask had been for 3 years worth of funding, and a decision had been made to do the 1-year pilot, which ended. And in Sacramento, we were able to leverage additional dollars to keep all 5 of our partners on through the rest of this fiscal year. And so my request, I should have said this during the presentation, but I wanted you to hear Mr. Khalil's presentation, but really just thinking about, the relationships, the work, the momentum we have going after that first year, some of us trying to figure out how to make it work for this in-between time while you all look at the findings and assess, how successful the program was. But any sort of decisions that you all would contemplate for the rest of this fiscal year going into next year's budgets. Those asylum seekers, if we could expand to serve asylum seekers, that's a huge need that we just aren't tapping into.
If I may just very few seconds about asylums, we have huge population came to Sacramento, crossing the borders from the southern. And they're coming also from other states. We have families coming from Texas because they do the same thing there. And they are coming to Sacramento because they somehow, Sacramento for them is a safe haven for the luxury of support and the luxury of resources that exist here. Other states, they don't provide that same support. So that's why Sacramento became the #1 in the nation as a point of hope for those and a wish to be in for all the time. And it's all word of mouth. They're all calling each other and they bring them, encourage them to come here. But that put a huge burden on the resources, whether on the state level, on the county level, and also us as a full organization that we are striving to survive our own, but we have this significant influx of additional resources needed, but clients that need service, but we don't have enough resources.
Thank you so much, and thank you for the question. We are going to move on our agenda item, to commissioners' comments and any advisory committee questions. We are running a little bit late, so if there's sort of burning comments, otherwise we will move on this. I don't see any commissioner comments, so thank you on that. We're going to move to the First Five Association's presentation. And just so everyone sort of knows the rest of the agenda, one, a deep thank you to everyone who is here participate. I think we are going to manage to get all the presentations in today. And I know that you may have come at the very beginning of the meeting and it took a long time. So appreciate your grace. We're going to sort of generally allocated about 20 minutes for the First Five Association's presentation. And then the executive director is going to share her comments. And then we have about a little less than an hour-ish on the small population county funding augmentation, so that we can leave here at 3:30. And that will be our last item of business after the other thing. So we will absolutely be able to hear everybody, but I wanted to just let you know our schedule. Again, we're not going to take breaks, so if you want to take a break, please go ahead and do that. And with that, I look forward to the First Five Association. Yeah, I know that Director McDaden is not with us today, and so look forward to the wonderful presentation. Thank you.
Thank you.
Okay. Excellent.
So thank you for having us. My name is Courtney Armstrong. I'm the Director of Government Affairs with the Firstside Association. I've been with the association for just over a year. I'm very pleased to be in the Firstside family. I'm here today on behalf of Alba Macbethian, our Executive Director, who unfortunately is at a funeral today and really wanted to be here, but has to attend to family matters. And so we had considered rescheduling because this is a very important matter for the association, but I know due to your change in calendar, that would mean we wouldn't see you until May, and this felt really pressing. So I'm happy to be here on his behalf, but wanted to express his desire that he could have been here as well to speak to you all. Next slide, please. So just to give you a little overview of what we'll be talking about today, we really wanted to highlight for you all the urgency that's facing the Firstside Network. I feel like it's well timed with the other presentations that you've had today to highlight all the important work that's happening at the county, and we really wanted to put a spotlight on the revenue challenges that I know the Firstside California is facing as well. But just to really draw a picture of what that looks like at the county level, and very blessed to be joined by two executive directors, so they can really give a better local picture. Heidi Mendenhall from, you said it right, okay, and Jennifer from Santa Clara. We also want to make sure that you're updated on our association advocacy plans. I know that with Sarah's departure and some of the transitions that happened, we haven't had our monthly policy meetings for a while, and so while those have kind of fallen off the schedule, I realized I have not done my due diligence update about what we're working on this year. So wanted to make sure you had all of that. And then that also makes me remember that I wanted to flag for the refugee question around federal advocacy. We should discuss that too, because I know there was some contracting lobbyists that we should put on. So with that for another meeting. But then also really coming to you to ask your partnership on a number of items that we've identified as a joint interest between us and Firstside California, and would love to work more closely together on some key initiatives this year. Next slide, please. So we have been preparing for our annual advocacy day, which is coming up on February 7th, where we will also be in the Capitol highlighting for the legislature and the governor with the revenue decline that first 5 counties are facing really means for children and families. And so we've been playing with graphics to try to represent what that looks like. But really, each hand there is about 10,000 children and families. And as you saw today, obviously we need to update our numbers. So we're really, as counties, reaching 1.3 million now. Children and families, and that also includes the almost 100,000 providers. So if you then try to look at how many children and families those providers are touching, that number obviously is even higher. But that's about what the reach of our counties are as best as we can represent it. Next slide, please. And of course, the bad news for all of us is that we are facing ongoing challenge from revenue decline. You know, previously we had been facing steady decline due to decreasing tobacco use in the state, which obviously is something we all support. And it's very interesting to see the presentation from earlier and how this aligns. But for us, sort of the defining moment really happened with the flavored tobacco ban, which again, we supported as a ballot measure because it's the right thing to do for public health, but it really impacted us pretty significantly from a revenue perspective. So the number I wanted to just make sure to leave you with is that $133 million annual revenue loss that includes the Firstside California number. So for the counties, what we're really meaning is it's $100 million loss to our revenue every year. And it's really that cumulative effect of the reduced floor for our revenue amount, which is what the counties are facing today, and we'll be able to illustrate what that means for you. So yeah, it was well, I won't bore you with the numbers, but basically it was like a very steady rate of decline, and then we just hit that 27% decline since 2022, I think. So that had real world impact. Next slide, please. We have been working at the association to try to quantify what that means for our members, especially as we're looking at legislative and budget possibilities for working with the legislature and the governor. And based on a survey we conducted over the last about 6 months of our membership, we got about 47 of 58 counties to respond. That represents about 88% of the states, almost 90% of the state's children of 0 to 5. And based on their reports, about 42% of the counties have cut services for children and families this year. And when we look at what's planned for next year, that number jumps to about 60 or more than 60%. So those are real world impacts that are happening now and will just continue to get worse because of that floor decline that I talked about earlier. Next slide, please. So again, we're playing the graphics here. We just wanted to make sure we could represent what does that look like, right? So if we're talking about the 1.3 million children and families that we were able to serve, you can see that percentage is going to be pretty significant, especially once we get to this next fiscal year. Next slide, please. And we also just wanted to give a little bit of some more concrete examples of what that means for some of the services that are being reduced or cut entirely. And I put first 5 county staff and laying off first 5 county staff up top. And also wanted to highlight how vital those roles are that we're losing that are really hard to quantify. So those staff, that loss of first 5 staff really undermines the ability of county first 5s to play the key role specifically mentioned in the statute, which is the advocates, champions, system connectors, capacity builders, and leveragers. So those staff are so vital for helping counties connect between siloed systems and support the whole child and whole family approach that I know we all share. And so as revenue decline continues, it undermines our ability to connect those siloed systems. And that impact is very hard for us to quantify, but hopefully you all can understand based on where you sit about how important those people and staff members are. And then, there's some other examples here. Obviously, these cuts are diverse and affect parents, caregivers directly. These are rolling back investments that communities have relied on and that the state has not yet invested in at scale. So some examples of that are home visiting, the infant and early childhood mental health services, consultations, and family resource centers. Next slide, please. So I'm going to turn it over to my colleagues. So first will be Heidi Mendenhall from Tehama, and Jennifer Coy will follow from Santa Clara County to give kind of 2 different perspectives on what that looks like locally. Hi, thank you for having us here. I'm Heidi Mendenhall from Tehama. Some of you probably know where that is. Most of you probably don't. Our biggest city is Red Bluff. So if you're in a rodeo, you may have attended our largest 3-day rodeo in the States. And we cover a vast area of land. We have about the same amount of humans as cows in our county. There's around 60,000 of each. And that 60,000 humans live, 65% of them primarily in unincorporated areas. And so that's really critical to understand because we have 2 cities, one over 10,000. And that means that we are having a hub of resources that cannot get to the majority of our families in those unincorporated areas. That is just one of the reasons and big, huge key roles that First Fight Tehama plays in being that flexible glue. And we know that the reality is that with government entities, there's not a lot of flexibility. And if you can't call, get online, or get your body to an office, you may not be able to get that absolutely essential resource. So First Fight Tehama does a lot of work in the staff realm around systems and funding systems like online data systems and humans that go with those data systems to connect the families to resources. That's one thing that will be looked at reduction or is being reduced next year. Another key example is around home visiting. we were the initial investors in home visiting, and at the gratitude of the state investment, have been able to decline some of our investments in home visiting. However, with the lack of funding, we had to drop significantly. So the difference between last year to this year resulted in over half the families not being served that were previously. Because of our relationship to our County Health Service Agency and many conversations, they saw it as valuable and were able to draw down some funds to support. But there's some key differences in how they can support and how Prop 10 funds can support home visiting, one of which is the eligibility requirement. So we can support and do all families in the county, because as you know, unfortunately, trauma doesn't know a name, right? It can show up in many different ways, and you might not fit a box that is required by a different eligibility. Yesterday, we had a commission meeting, and one of the home visitors came and shared a really impactful story. She was a home visitor for the program that Respect to Him funds, and she had been serving a family for about a year and a half. They were a newcomer family, and they had been with her like right between 18 months and 20 years, or 20 years, not that long. No, 18 months and 20. They chose to back off and didn't want to engage in home visiting anymore. Okay, and 8 months went by. They called, they said they wanted to come back, so they did. There wasn't red tape, they didn't have to get re-eligible, they didn't have to go through a process. And the big piece of the story is that on that first visit, they shared that they had been in domestic partner violence for that full time that they were with her. She has been trained in domestic violence response, immediately got them to a safe place, and now goes grieving because that mom are safe and progressing. She actually enrolled in college and is doing some courses. But that wouldn't have happened if she had been in any of the other home visiting programs, because there would have been that barrier. So those are the kinds of things with the flexibility of what type of people in our small counties that might have less people, but they have significantly as much.
Thank you, Heidi. I'm Jennifer Floyd. I'm the executive director of First Five Santa Clara County. Obviously, one of the significantly larger counties than Shima. Their people plus cows is actually less than the number of children under the age of 6 that we have in our county. We have 133,000 kids in Santa Clara County that are under 6, and a quarter of them are on Medi-Cal. But the rest of that story is because the cost of living in Santa Clara County is exorbitant. We have a huge number of GAP families that really can't afford to live in our community and access important things for safety and basic needs, but aren't eligible for any of our programs. And again, that's an area where First Five is key, and we just named that population as one of our priority populations in our new strategic plan. So just to paint a picture revenue-wise, Santa Clara is one of the larger counties. This year, our community investment budget, what we were giving away to community, was $21 million. We just issued our first RFP first large RFP since I came into the role. This is for most of our community investment for the next 3 years. It is $29.5 million across all 3 years. So you do that math, we're talking about a really significant decrease. One of the biggest things that we fund is family resource centers in our community. We have 26 family resource centers right now. Looking at the parameters of that RFP, which again, we're still in the process, we haven't even received applications yet. We have a total of 18 million available to support place-based services. So assuming we give grants at the maximum amount for that, we will be looking at more like 8 to 10 resource centers. So just the economy of scale of impact in Santa Clara County is really significant. Just talking a little bit about our RFP process. As Heidi said, we really are an expert in our counties at filling gaps, bringing systems together. Many of you are probably familiar with the Kids Connection Network in Santa Clara County, which is a specialty behavioral health services program that was designed by First Five many years ago in partnership with behavioral health. One of the things Courtney elevated is there's an actual cut of the money that we won't be providing, but then there's the leverage dollars that won't come with it. So in Santa Clara County, that behavioral health system, Kids Connection Network, currently we give that network 1.7 million a year, which is then leveraged for over 10 million. And we've already identified that support is not sustainable starting next year. So that's just an impact of how a system is going to have to morph in order to potentially maintain what was developed as very much a specialty targeted service for our youngest kids, because we know, especially in behavioral health, an 18-year-old service looks very, very different from a 2 or 3-year-old. So just sharing again, 2 very different counties. We are only really hitting our major fiscal cliff this year because of that, the tobacco ban, despite leveraging our fund balance and really spending it down pretty close to almost nothing by the end of this next strategic plan. So again, just a picture, but I think I'll turn it back to Courtney, who I know is gonna put together some, or maybe I'm turning it over to Bobby.
I have one and then Bobby, and I got feedback that I was speaking too quietly, so I feel like I'm yelling at you, but I also want Zoom to be able to hear. So next slide, please. So just a quick slide on our advocacy efforts this year and what we're trying to do to address some of these challenges. So in December, our board passed our 2024 policy priorities, which includes as one of the top items, securing funding towards sustainability to both offset the impact of the Prop 31 flavored tobacco ban and overall declining tobacco tax revenue. So what that looks like for us right now is an attempted state budget request. We recognize that this is a terrible time to be making a general fund request. We also recognize that this is a terrible time in our counties, and that if this was a cut that was coming from general fund, we would be yelling, right? So we feel like it's our duty to at least be highlighting the cuts to services that people are facing in the counties, and that legislators may not know are at risk of going away. Even though we are fully aware that this is a very long shot item, we also feel like it's our duty to at least highlight the need and the impact to Californians across the state. We are also in discussions with a number of different groups about a broader prenatal to 3 probably statewide working group. We would be asking the state to convene a statewide working group to really look at the broader prenatal to 3 systems and help identify where those gaps and challenges and opportunities are, so we could collectively, as a broader coalition, bring forward a set of recommendations to the legislature and the governor. And that would be, again, in coalition with a bunch of other children's advocacy groups and hopefully First 5 California. And so then I think that's it for this slide, and I will now turn it over to Fabiola Gonzalez, who's the First 5 Fresno Executive Director, is joining us by Zoom. She's also our new board chair, and so we're pleased that she can join us remotely to finish our presentation. Hi, Bobby.
Hello. I hope you can hear me. If you can move to the next slide, please. Our aim with the presentation today, commissioners, hello, everybody. I hope you can hear me okay, yes?
Yes.
Our aim with this presentation has been to center the urgency facing local First 5 commissions and emphasize that our revenue challenge is here to stay and needs our collective attention. So we turn to you as the state First 5 entity to join us in addressing our collective challenge and help us write the next chapter of the First 5 story that will definitely look much more different than the last 25 years. The requests that you see on the screen, we believe are both necessary and doable. Partner with County First 5s and the association to identify and implement solutions for both short-term challenge and long-term sustainability. Allocate First 5 California funding to stop cuts in direct services for children and their families. Advocate with us with the administration and legislature for funding to prevent the immediate county cuts that you heard about earlier. Collaborate on strategies and timeline for long-term sustainability, including what Courtney mentioned in terms of our work group bill. When it comes to First 5 making a difference in the lives of young children across our state, we are your ambassadors on the ground, putting into action by way of systems improvement efforts, services, and programs, how to create that safe, stable, nurturing relationships and environments for California's youngest children and their families that is in your North Star. We are the ones that put that into action, and we feel that there's no you without us, and similarly, there's no us without you. So as we get ready to share with legislatures what's at stake, including less supports to our most vulnerable children and their families right now, we know absolutely that magic happens when we rally together, and we feel it's imperative to partner with you in new ways, because we already partner with you, but we want to find new ways to find that unified path forward so that kids continue to be prioritized and not overlooked. You heard that $100 million are lost moving forward every single year, touching the lives of young children and families. So we're here to ask for your support in figuring this out as we look forward to the future. We thank you in advance for giving these requests serious consideration, and I'll pass it back to Courtney.
Thank you, and I'll pass it back to you all. Thank you for the time on your agenda today. We're a little bit over, but not too much. So.
Thank you so much, and I think First Five Los Angeles may be on the phone.
Celia?
No. You might be on as a wait comment.
She missed the public comment, so.
So we don't have to comment on this. I just got it.
Okay.
So.
I think she wants to now?
Yeah.
Okay. Okay, if you from Los Angeles want to speak, we're happy to hear you. Okay, just keep us posted. Thank you so much for the presentation. Let me open it up to commissioners for any comments or questions or thoughts.
I don't have any questions that are jumping out. I just appreciate you all sharing the different impacts of dollars. And I will just underscore, and again, I always try to put my day job in front so you guys know, I run programs that are recipients of a lot of these dollars, and it's been tough, especially in Los Angeles, which has its own challenges in terms of the distribution, the equity of funds. And we really struggle to think about how we, spin this dime, another way and split it, and it's really challenging. So I appreciate you. I definitely see you, and I thank you guys for continuing to elevate different ways. And just know that we all encourage the commission, First of California, and the counties to really work together in a way where there is an appreciation on both sides of the challenging decisions we have to make in support of the First Five California, but also the individual struggles that you guys are seeing with the faces of these children and families, and I know and trust that we will be able to come up with some great decisions as people are not smoking as much. Yay. But I know that we'll be able to figure it out. And I'll just throw out that I always hope that there's a way we can figure out how to grow revenue. Because we're not gonna be able to split this dime too many more ways, but if there were other ways, and I'm speaking way out of turn, but to be able to find ways to grow revenue, that would be a real.
I just want to echo that, and I think one of the things that stood out to me is how do we collaborate more, how do we partner more, how do we drive the impact to maybe come up with new sources of revenue, and or think about creative ways to leverage the dollars available. And the other piece, I think, as I'm talking, at least San Diego, is that I know some commissions or counties are looking at local revenue sources as well. And so really appreciate that work that's happening at the local level, not only looking at the state, but really getting creative about other ways to find money, other places to find money to support our kids.
Commissioner Rizzo or Jimenez or Paz, any comments or thoughts or questions?
This is Commissioner Jimenez, just to follow up a little bit on Vice Chair Hazen's comments regarding how do we partner more with our local First Five Association and all the local counties, considering just that we have this need to have public discourses, public discussions. How do we better engage? And I think the sooner that we can engage in those conversations so that our state association, our state commission, and then our local association are aligned is really critical. You know, it sounds like many are already making cuts or planning to make cuts. And, you know, just like we kind of were looking at our admin budget and planning ahead to figure out how we can kind of right size it. So before we actually experience that financial cliff, I'm wondering what are the vehicles that are available to us to be able to have direct conversations with First Five association staff so that we can plan accordingly. And I'll just throw it out there as a conversation that we could have under our finance committee as a standing agenda item. Does that mean then we have to open it up for public, or can it just be the finance committee members, you know, Commissioner Riso, myself, meeting with the First Five Association, ED, and maybe the chair of the association? You know, I'm just putting that out as a possible opportunity to be more intentional and proactive in having those discussions sooner than later with respect to how we can support our local First Fives and ensure that services continue to be delivered at the level they are now and increasing as more and more of our families are just facing more challenges with respect to being able to just meet basic needs, much less be thinking about early childhood and other critical elements. So I'm putting that on the table if as a possible option, and then deferring to legal counsel to weigh in on whether or not that is a possibility.
Thank you so much, Commissioner. I'm from San Francisco, and we measure the number of children by, fortunately, the number of dogs we have in our community, and there are more. And that's how, unfortunately, our county makes its priorities. And so when I hear that there are potentially family resource centers going from 26 to 8, and there are cuts in home visitation, that gives me great, not just pause, but deep concern, particularly when you think about the impact of First Five programs, and we heard what's happening with Retta in Sacramento. So I think what you're hearing from us is we are grateful to you for your work. We appreciate your advocacy. We understand that this is about families and how are we going to serve the youngest in our communities. And you've heard some suggestions and ideas here around increased collaboration, thoughts about collaboration with the finance committees, revenue maximization. How do we do this together? What does that look like? Revenue enhancement, revenue increases. So I think what you're hearing from us is we hear you and we understand the importance of partnership and collaboration. And thank you very much. And with that, I'm going to turn it over to our director for both comments on this and her report. And then we'll go to our final presentation after that. We have one comment.
And then we'll come after I speak that. So, and I know we're short on time. So one, appreciate your presentation. It was very thoughtful and collaborative. As you mentioned, I know that even before Sarah left, we couldn't kind of get together. So thank you for sharing what your policy priorities are. We are proud that Sarah project has moved to Children Now to focus on T-12 issues is really where she originally focused on. So really just excited for that opportunity for her and our continued partnership with TED and Children Now in that capacity. And so with that said, we, as many know, in the 90-day report, we've been kind of talking about the network for over a year. We funded those collaboration meetings and how sustainability is one of those top priorities. And we have not yet been able to get to the point where we're actually, let's sit down and meet and talk about what that means long-term and short-term for various reasons, transition, whatever we are. We can present Commissioner Jimenez this idea of working in the sub, but please do know that Ava and I are talking to each other about the short term and long term, and understand that this is a network issue of 58 counties and the First Five California, as well as First Five Association. So really it's a body of 60 different EDs needing to kind of get together on trying to figure out what that means. And we are going to kind of start some of that work at the First Five Association meeting in February. where we'll be presenting on that and hopefully landing on some next steps there. But really appreciate, seeing the, advocacy strategy today. And we will be digesting what that means to us. I think that, and just, again, grateful that you all helped us close our admin account by, again, what we learned from you, we actually also took back, and hopefully it's a reciprocal conversation always. And just grateful to hear where you are, all of that. So, I don't have to belabor kind of what you've already read in the report. It's really dense, the budget. However, March 25th is our summit. So, and I know we intentionally selected county specific, and I think some of you are, no, oh, sorry. Oh, so many first 5 counties are actually presenters at our summit. So, after 25 years, so again, continuing to lift up the impact, not just here, be able to kind of publicly do that with over, Jamie, you'll remind me, 100 sessions we have. And so that is another way, not just don't have a commission, but you get to tell your story to the entire, Mr. Early Childhood advocates, stakeholders, other partners that are in this room, but also outside this room, who can support a sustainability conversation for all children 0 to 5, and how we all want to grow revenue for this population, families, and machines, rooted in equity and also in justice.
Thank you for, and also thank you for your briefing and the short, we appreciate that. I think we have one member of the public on who wants to say something. We have trouble, we have unmuted. Oh, okay. Celia, you are on.
Perfect. Thank you so much for that technical difficulty that I wasn't able to say anything. Just a brief public comment or brief comment on the ED's report. Good afternoon. My name is Ofelia Medina and I serve as First 5 LA's Senior Policy Strategist. I just wanted to say that on behalf of First 5 LA, we would like to acknowledge the strong partnership efforts by First 5 California in leading statewide campaigns that advance the benefits of the First 5 network. First 5 LA has partnered First 5 LA has partnered with First 5 California in various efforts, including our home visiting work to support pregnant people and families with children in the first years of life, and in efforts around increasing the awareness of the benefits of bilingualism and the value of home language. This piece, our early care and education and communications teams are currently in the midst of expanding a county-wide public awareness campaign to promote the importance and the value of supporting DLLs both at home and in early learning environments. First 5 LA is really happy to partner with First 5 California in these and many other initiatives, and commend Jackie's strong leadership on making sure that the network continues to prioritize children and families. We will continue to explore those opportunities and work closely with the whole First 5 California team to ensure that we're driving towards population level results for young children. In the meantime, we look forward to partnering on Saturday, February 18, and look forward to seeing the whole team as First 5 LA First 5 California will be here in LA at the Los Angeles Black History Festival and Marketplace to be in community with our families and raise awareness about toxic stress as part of the Stronger Starts campaign. Thank you so much. And again, I apologize for the brief technical difficulties earlier.
Thank you so much for joining us. Shows the breadth and depth of California to have all counties involved in the conversation. Any additional public comment on this item? This item being item number, our reports under our regular agenda. Okay.
That's more population.
Exactly. So we have one more information item, which is item number 9, our last item for the day. And thank you very, very much. I appreciate all the work. Small population county funding augmentation. I know that Dr. Dominguez is going to be presenting this information today. I will say, just as a point of information, ideally we would adjourn the meeting at 3:30. So a little less, for like 50 minutes. while Simon pulls up the deck. We wanted to give you guys an update where we're at with our augmentation to small counties. I think you guys all know that First Five has been funding small counties. We can get to the next slide. I could talk fast, so if I talk too fast, let me know. I'll try to catch up on time, but overall, First Five, as I said, has been funding small counties with low birth rates, and this has been something that has been going on for some time, and I believe I have some timeframes, but we'll get through that in the next couple of slides. But the premise is the augmentation funding is additional funding beyond the 80% that counties get. It comes out of our 20% allocation. Next slide. This is just a reminder, and Shane, I appreciate your comments on our earlier slides. I do want to say the result-based accountability principles, as we've been addressing them, you know, they're connected to the North Star, audacious goals, and things targeted. Also, it matters on the workforce and how we do business, how we get processes done, administration. So that collectively, that's the framework that we're trying to infuse in our day-to-day practices, not just the theory. The theory is the change, but the practices on making sure that we're being accountable in every step of the way. Next slide. Before we dive in, I do want to just give some context. I think collectively, we all know birth rates in California have been declining. Between 2021 and 2022, we had a slight shift in the increase. And also that could have been because of COVID. We all know that. There was some changes there. But overall, we do know that California and women of reproductive age and public health has been doing some great work because women are waiting longer, later in their lives to have babies, or they're just being mindful of how they're having or spacing births. Next slide. Specifically to small counties, we're looking at numbers. We also have noticed that there's been a decline from 2021, and then in 2022, there was an increase. I will say that with small counties, it's really interesting because most of them, you know, these are all in-state births, but we do have a couple of counties that have out-of-state births that we tend to get that information a little bit lag behind. But we are very mindful. For instance, Modoc in Nevada may have out-of-state births, so we're really mindful of that. But just wanted to give context of birth rate in terms of the small county. Next slide. When we're looking at children from 0 to 5 within the small counties, looking a little bit at the demographics, we're seeing the different numbers and also the age group. So in this slide, you'll see the demographic, race and ethnicity, and then the age on the green. So 0 to 2, and then we have 3 to 5. So just to sort of level set, but for the most part, we closely have close to 47,000 children 0 to 5. Next slide. So this is where my ears come in. I do want to speak out of term. 1999 was really when the inception of the augmentation, and Nina will keep me straight. But essentially, for the most part, on average, based on the data that I was able to collect and with the team, for average, it's been about 200,000 per year for each of the counties, and things have fluctuated, you know, over the years, but that's on average. And then currently in January of 2021, you all collectively have approved an investment of 20 million for over 4.25 years, which is currently where we're at right now. And that started on April 1st, 2021, and it ends on June 30th of 2025. And then there was a breakdown of how those dollars were going to get allocated in terms of time frame. So there was a first phase of the first 3.25 years, and then we still have another year with an extension based on performance. Folks needed to submit their annual progress report. But for the most part, you know, we received the majority of them to date. And then the budget breakdown that was approved in 2021 is what you see on the slide. Next slide. When we look at all the counties for the collective 4.25 years, this is the breakdown for each of the counties.
And we've shared this with the counties, it's on the website, and we continue to remind them, we're still, moving forward with this, and we're in the process of doing the 1-year amendment process. And by starting January 2024, that means a process collected internally for us to add those funds to their additional grant, process that they have currently. To date, we received 16 out of the 21, annual progress report. We are following, because of how the state and we're public stewards of funds, we have to follow our RFA, which is a request of application, the parameters and deliverables to release the public funds. For the 1 year, we are going to make some tweaks, and this is something that we've heard from them collectively and also in partnership with the First Five Association to make their reporting a little bit leaner and streamer. So we plan to do that, but we do have to adhere to our Department of General Services, which is really our contracts and grant procurement control agency. And then also to our state control office, which is all the guidelines of invoicing and making sure that we have the proper documentation to get the monies essentially out the door. But for the most part, just wanted to give you guys an update, but the breakdown of funding, this has not changed since the allocation or the augmentation was approved by you all by January 2021. Next slide. So this is a fun slide, and those small counties that are online and here, you may have seen an increase in the green, which is yay. And the reason why it's a big yay is because we recognize that we had some internal challenges with documents and processes. So this is part of our result-based accountability improvement. And we recognize that we needed to make some shifts in how we were doing some internal processes, but also in making sure that the documents were moving within our internal control processes, but also with our external control processes. So essentially, if you look at the level of completion, those color coding, hopefully you see step 1, 2, and 3. That means essentially in order, we needed to reconcile budgets, and you all know this, if you oversee an organization, get the right size, making sure that your budget's aligned for year 1, 2, and 3, and to ensure that all the invoicing goes in place. And if folks needed to move any line items or move dollars from one year to the other, we were able to adhere to that. So we had to do budget change requests. And then as a result of that, we had to do some execution so that we can add the remainder of the dollars. That really puts us at step 4. And that's where we're at with the majority of the small counties. And also for them to get their reimbursement and paying folks. This is a huge success for us. We acknowledge there were some challenges, but I do have to give credit where credit's due, and that's Lakshmi Purahava, and I hope I didn't butcher her last name, which is one of our main consultants here, but also Kristen Torres and the rest of the program innovation team. Because it really was all hands on deck, and also our contract procurement office team here, Earl, wherever you're at, and Marcia, they were super helpful. You guys don't even know how many meetings we had to get to the green, but this is a huge success for us because it really allowed us to date. We've also been able to process quite a few of these invoices, essentially to get monies out the door, because that's really our commitment to making sure that folks get paid, and making sure that we move things along and making sure that we make the improvements internally, also externally as we can. Next slide. We do know that the small counties are super creative. They already do this, and we want to learn from them and vice versa. They leverage a lot of rating funding sources. They use a lot of local, county, state, federal dollars. They also are super creative in doing that medical reimbursement, which is awesome. They also partner with CalFresh, United Way, and they do a lot of fundraising, which is amazing. And they also partner with a lot of local organizations such as the YMCA, the school districts, adoptive parent supports, and just different entities to help support the families. So we do know that small counties, they're really doing that systems change at heart, so we really want to acknowledge that with the funding that they get from us, but also the funding that they get from other sources. Next slide. Also too, this is something, that I hear loud and clear from all of you, that you guys always want to hear what the small counties or the counties or partners are doing. So I just wanted to take a second to just acknowledge a couple of the small counties. No particular orders, just alphabetical. I just did a sort of we just kind of picked different counties: Calaveras, Colusa, Del Norte, Mona, Mendocino, Plumas, San Bernardino. All of them do some specific fundraising. You can see from the bolded language that they do diverse programs. Colusa does a bump and beyond. Mendocino has adopted an equity statement to meet their population. Plumas is doing a fatherhood engagement, which is really amazing. And all of them are just being really creative, and we read everything that comes in, and we're being very mindful of how they're putting their dollars, but also you see on that deck, I know it's pretty heavy in text, but you can see the different grants or additional funding that they get to support their efforts. So that's the intention of this slide. Next slide. I love this slide, and I know the person is here, Nina. Thank you for sharing your messy mornings pictures, and she does this Fridays, every Fridays. I feel like I have messy mornings every day. So, but essentially, the messy mornings allows families, caregivers to come together. That's one of the biggest programs where the kids and family and caregivers are able to also exchange information. As you all know, social support is huge, especially during this age and then just period of transition. So just wanted to highlight that, mainly because of the creative way of them engaging their communities, but also engaging the families at the local level. So we really like the messy morning.
And bringing the community resources together in a
Yes.
one-stop shop location. That was just so.
Next slide. In terms of the funding, one thing that we've acknowledged in the last couple of years is we've also acknowledged that small counties also increased from 20 to 21. They added Mendocino along the way, which is great. The premise of the funding also, depending, at that funding climate at that time, also was they met their needs. Currently, what we are proposing, and we will continue to have discussions with all of them, and the next year, this year, I should say, is we want to find a baseline amount so we can fund them per year. Or essentially, we want to continue to fund all 21 counties based on their low birth rate and the criteria that has been used. We want to continue to do leaner administrative process of adding quarterly reimbursement, which is, we've been doing that now, but we found some improvement. So that's an area that we acknowledge that we can do better. But essentially what we do want to give them is a baseline amount, because they want to know, they want to project that a dollar amount so they can plan ahead for their program. So that is something that we're looking to do as we're looking at budgets and revenue and so forth. But that is something that we're looking to explore, and also have the conversations with all of them. We just had one this month with them, and we hope to have them quarterly until we reach the next funding cycle with them. Next slide. As I said, one of the things that I've done since I joined the team, I joined the First Five family in August. I think you may or may not remember, but I joined the team and I learned a little bit more about the consultants. I realized this is a multidisciplinary team, and we did some shuffling of who or what portfolios met or work better for each of the consultants to ensure that we can leverage on each other's strengths and making sure that we can increase opportunities. As I said, now Lakshmi will be leading the small counties, and she's done the work before, and she'll continue to do that. And she's been doing a lot of the remediation and consolidation with the counties and getting the paperwork. And those are the steps that we had to do to ensure that we were accountable to the work and program that we had. Next slide.
So again, this is more of a regurgitation of what I've been sharing, but essentially what we want to, continue to do is fund all 21 counties, with the same criteria that has been used. We want to do the grant allocation. We know that that's, a easier, leaner way to do that. Because we have public funds, we have to follow that process as opposed to a contract. A contract would add a little bit more burdensome with the grant. If we do it right, it will be a little bit more leaner on that. We know that the reporting structure could also be leaner. Instead of them doing that, for example, an annual progress report, we would have them just report at the end of the year and add it to the annual report. So they're all reporting at the same time, and we can build a system to collect that data. We're also building the administrative support internally here. We're getting better at, working better as a team, but also there's other resources that I know we can bring together to support the small counties. And then we can also explore more creative ways for them to use those dollars as a way for them to support their operations, because that's how they've been asking us to use the dollars. And if we do that, we would leverage the education and training sort of deliverable, and that would allow them to use those funds in a more creative and leisure way, I would say. And then obviously with everything that we do, we want to do programmatic oversight just because we're stewards of dollars. And then we want to continue to just make improvements as we move forward. But we also are considering doing what they're doing at the local level is also exploring the conversations that you've all been discussing in the last 40 minutes, is finding additional funding sources. Like, what other funding sources can we bring to support the small counties specifically, or even just for 5? I know my experience coming from public health, I've always worked with CDC Foundation, HRSA, and other funding sources. So that's an area that I'm interested in exploring to support them and provide them that technical support that they need so they can focus on serving families and children. And I believe that might be my last slide. Next one. This is just the repeat. You heard Jackie in the December meeting, the commitment of working with small counties and the First 5 Association to support them. We are still aligned with that. We'll continue. We're committed to funding the small counties. Obviously, the revenue conversation is something that's real with all of us, so we'll have to continue to have that. But with everything that we do, we'll do our quality improvement on it. And I think that's my last slide.
Thank you so much. I think we have members who would like to speak, who have been here for a long time, coming from small counties.
People would never leave.
We see the best below.
If you would indulge me, would you like to stand up for 10 seconds, everybody, and root you? Some of you.
Good idea, John.
Thank you.
We appreciate you, because I was thinking about, we've been trying to do a trauma informed check-ins with everybody every time. Thank you very much for that. Yeah.
Thank you for allowing us to be here today to talk about small county augmentation. It is something very near and dear to the association's heart. Our presentation is going to be amazingly similar and has quite a bit of overlap with what the staff did, and we didn't coordinate it to do that, but it's nice that it will work out. So as you know, Aldo can't be here today. He's down at a funeral or a memorial service, and he does send his regrets. But I think it's significant that it takes 2 of us to do one of Aldo. So keep that in mind. My name is John Sims. I don't know all of you, so very quickly, I spent 13 years as the executive director in Stanislaus County and retired out of there. I was then asked to come back to the association to serve as their interim executive director between directors, and served as the association president also in that period of time, actually before that. But I came out of retirement to do that interim work and to consult with the association and First 5 California. So I've actually worked here as well. So Simon,
Yes, sir.
If you wouldn't mind the next slide. So here is the geography of a small population county. But immediately after the adoption of Prop 10 by the voters, the state commission recognized that there was not going to be sufficient funds to have a statewide program in all 58 counties. And you stepped up immediately to begin funding education, right in first year, so on 1999, 2000. The funding formula, of course, would only allowed a small amount of money for the smallest county. My favorite example is always Alpine. They had about 4 birds and they got about $5,000 or $6,000. Just not enough for them to be able to do anything. So the state commission stepped in and said, if we want to have a statewide program, we need to do this. If we want to have a minimum level of service, we need to do this, and you've done it. And we certainly do appreciate that. So not only the small counties, but the large counties as well. They see that need to have a statewide program. They're glad you're doing what you're doing to create that. So thank you very much for that. Now, the current augmentation for the funding cycle, or the current augmentation funding cycle began in 2021, and it's been authorized through June of 2025. The eligibility is for any county having less than 1,000 birds. And there's a sliding scale of augmentation for those counties. Let's get sliding in a minute about that. But I do have to say, you know, the years I've been associated with it, that the tone, the demeanor, the philosophy of augmentation changed significantly in 2021. It steered sharply away from augmentation and became more transactional, more contractual, and had an intensity of oversight that we were not used to seeing with this program and haven't seen with other programs being operated by third parties. So I guess this is a spoiler alert for the presentation, but in terms of administration and reporting, this has actually created more burdens on the small county than it has relieved, which is stated objective of the project, is to create less of a burden. And a lot of these small counties only have 1 or 2 staff members, so it exponentially increases the burden there. Now, the 21 counties highlighted on this map face unique challenges. They're small population centers that are widely distributed in counties. You just heard Tehima talk about that very thing. So thank you, Heidi, for making that point. But with that distribution of people, costs go up and difficulty of providing services goes up. And even the distances with these small counties is amazing, because the county seats in these small counties can be anywhere from 30 minutes to 2 hours apart. So they find they have less expertise, they have less opportunity to join together and do things. It's a unique set of problems that we don't see at other places in the state. So, okay, Simon, we'll move to the next one. Sheer volume of the land area we're talking about is amazing. I don't expect you to take a lot out of it, but 16 of the augmentation counties listed on this chart are larger in size than the state of Rhode Island. 9 of those counties are larger than the states of Rhode Island and Delaware, and 1 of those counties is larger than the states of Rhode Island, Delaware, and Maryland. So we're talking about huge, huge distances and population areas. Next slide, please. Don't expect you to be able to see this with any level of detail. And when I saw where you were projecting today, I thought, wow, I wish I'd known about that, but.
You know our setup, you work for us, you got off at the
I used to have a podium I could write my notes on, used to have okay, but this slide is the funding sources of the augmentation counties as a percentage of their total revenue. So the salmon color, I'm gonna call it salmon, which is on the bottom, but the salmon color is actually the augmentation funds. And that ranges from 3% to 85% of the county's total revenue. So the large counties are on the left, small counties are on the right, and you can see that salmon line goes up in a steady fashion. The blue section is the percentage of each county's statutory Prop 10 revenues compared to the total. And that revenue, we heard that earlier today, is what you calculate here based on the number of births and the tax revenues. And the green is the percentage of each county's other revenues. So we've heard earlier about grants, donations, foundation support. You can see that. So the takeaways from this slide is the smaller the county, the higher percentage of their total revenues comes from augmentation. The augmentation counties make a concerted effort to obtain other revenues. You can see that in the green line. And you can see on the far right in those green lines, the very smallest counties have less opportunity to get grants, donations, as well as foundation support. So I've got 3 counties to kind of illustrate and bring out some of the points that were made in this. And so we have Nina and Melody in the room, and then there's Nicole, or Nicole's supposed to be online. So we'll start with Nina, we'll move to Nicole, and then end with Melody.
Thank you very much. I'm trying to be quick too. I really appreciate where we're going with this, first of all. I think that we're back on track to the original intent of the augmentation. I have been with First Five since March 2002. So I have seen as it has morphed from an augmentation to a program with additional requirements, whether they were activities, fiscal reporting. It just became extremely labor intense, not just for us, but for you as well. And so I think that having a conversation and leaning back toward the original intent, and I've done this so many times since I've been here since March 2002, that I actually have already the highlighted part of the statute that says it's the intent of this act to emphasize local decision-making, to provide for greater local flexibility in designing delivery systems, and to eliminate duplicate administrative systems. And I think in listening today that we're heading back that way, which we very much appreciate. I also wanted to just highlight real quickly, Kathy from El Dorado County brought up an example of, the partnerships. We work together, whether it's Impact, home visiting. We led the home visiting grant for Amador Calaveras and Tuolumne because they didn't have the bandwidth to do that. And so I said, I'll take that on. And then we all benefited from that funding. But also for the large counties, we can turn on a dime where a larger county and, just a larger bureaucracy in general has a harder time doing that. So when Kathy mentioned that, we've grown this program in through Impact with the kits, the family activity kits and education that goes home to families in a creative way, it did start with the small county. And that actually, we piloted it, we refined it, and then it grew to our entire region, the option for them to be able to participate. And actually in talking about births real quickly, in Amador County, when I first started, the births were in the 200s. I remember a couple years in, it was at 264, something along those lines. We're now over 300. So actually for us, we're increasing. And as people can work via technology, we are continuing to increase. And I just wanted to bring that forward, that we actually wrote the same note at the same time because we are increasing, people are moving to rural counties, and yet they can still work in Santa Clara.
Is Nicole on?
Okay.
So if you can bring Nicole up.
There she is.
Nicole, please introduce yourself.
Nicole Hinton, First Five Modoc, and I'm just going to build a little bit on everything that John and Nina have said. So much like we've said, since 2021, reporting has become extremely cumbersome to all small counties under SPCFA. And it's really outside of the initial scope of Proposition 10. And so over those 2.5 years, we have provided data, input, extremely detailed fiscal reports, written performance reports, really focusing on systems change, those pooled services that you've heard examples of throughout the day, and fund leveraging that you can hear is extremely creative. And we've participated in countless surveys, meetings, and input sessions to meet these additional SPCFA requirements. But as you know, this takes lots of time and energy. And with most of our small counties having 2 or fewer staff, such as myself with 1.5, it really is taking away from local program innovation, partnership building at both the local, regional, and state levels, and really taking away from focusing on bigger picture investments that First 5 California has done, such as home visiting, impact, and the other ones we've heard about today. And most importantly, it's really taking away from serving our 0 to 5 population, their families, caregivers, and educators in the field. And it's really important for us to recognize collectively that all counties, including small, are required under Prop 10 statute to create and annually review their local strategic plans, conduct the annual audit to ensure all funds are expended in accordance with requirements, individual county strategic plan, and local commission policies. Also, we provide an annual report to First 5 California, as we discussed today. And that really does have a lot of our written narratives on the implementation and performance of local county commission work, which, as you can see, a lot of that is funded through those SPCFA dollars. And additionally, we provide certification of compliance annually, the ASD 035, which attests to all to meeting all those statutory requirements. So I will give it over to Miss Melody.
Yeah, thank you. My name is Melody Easton. I'm the Executive Director for First 5 Nevada County. And I was very pleased to see you were highlighted in your annual report presentation. I want to start off by, on behalf of my colleagues, thanking the commission for continuing to invest in small counties and see the value of the work that we're doing in the small counties in addition to statewide. We've seen a lot of progress in the last couple of months in alleviating some of the administrative stress and heartache that's going on. And so while it's trending better, there's still some things working in the works. The Nevada was one of the counties in gray there on our GAN, which has been in the pipeline for about a month. Our Q1 invoice has been in the pipeline for about 2 months to be paid. But we're still out there doing the work. In our annual report, we highlighted the value of our partnerships and the county-wide systems improvement efforts that we're participating in, such as our public health's focus on health equity, our county's work with FFPSA and the comprehensive prevention plan. We're deeply involved in that. And so anytime that we have to sit back and work on those administrative pieces takes away from that as well, and takes away from the ongoing support of families and children. We're also a team of 1.5. And so anytime that we can get back and get out in the community is well spent. But we're grateful for the opportunity to be able to continue to work with young families. We're grateful to the state commission, and we are very encouraged by the positive trend that is going forward, and the communication and the collaboration that we continue to see. Nina mentioned, we're also seeing a baby boom in Nevada County. People want to live in our beautiful rural counties because they can tap into their internet and work elsewhere while they're amongst the beautiful pine trees. And so First 5 is not going anywhere. We're going to constantly have young babies who want to get messy with their families. We're going to have FRCs and home visiting. But if our dollars continue to decrease, then we'll of course see a decrease in those services. So anytime we can leverage as much time and effort and funds is greatly appreciated.
So you can see on the slide that's up right now, the impact of the funding is the very existence of many of these commissions. Staffing, many of them couldn't even support them 2 or less. They have now matching funds for outside programs. Even participation with First 5 California program gives them the money to be able to do this, and great funding with other types of programs. Go ahead, Simon. So, as we mentioned, the current funding cycle started in 2021. Starting in 2022, in early 22, we started meeting with First 5 California to try and make this program, which was a real shift from the past, work a little better, be a little more coordinated. And we spent nearly the past 2 years talking about ways that we could do that. So after the 2 years, the association wrote a letter in November and sent it to the state commission with some specific recommendations. And this is the summary of those recommendations. The first recommendation is to provide this augmentation funding as augmentation. So more like the Prop 10 allocation. We believe it's legal for you to be able to add to the small counties allocations directly. And I see Jackie shaking her head no, but we are willing to provide some resources to have legal opinions on this. And we've already consulted the original drafters of this. So we do want to talk about this, as you can see. Secondly, we think the augmentation funding should be general operating support that aligns with Prop 10. Thirdly, providing funding in advance like what happens up until 2021. Fourth, accept the existing reporting, which is the annual reports as well as the audits, to fulfill reporting requirements. And then fifth, to have any agreements that are necessary to be there for multiple years so that counties can have a floor of funding and plan. So we don't think there's any reason to have those additional or unnecessary or redundant reports. So the last one.
Yes, sir.
So we would think we need to get back to a paradigm shift of augmentation, because the paradigm shift that's occurred has gone from augmentation to a project or a program or a contract. And we think that's not where we should be going. So this augmentation funding, from our perspective, should remove administrative burdens, and especially on these counties, as we've heard, that have such few staff. It should remove redundant contract reporting requirements. I think you've heard that theme through the entire time here. And center the funding in equity, recognizing that counties have specific and unique challenges as they provide services. So we are standing eager to continue to move forward to help improve this very vital program. We in particular would like to know if we can anticipate a response to the letter that we sent in November. We would like to receive that. So with that, that's all we have to present today. Go ahead, Simon, and we'd be glad to answer any questions you might have.
Thank you very much for that presentation. And I can imagine that being a staff of 1.5 in detail, there is a lot for the families in the community. So we thank them. Any comments from commissioners, questions?
Yes, and I want to be really cognizant of time. I'm curious, so there was this shift in 2021 that made reporting particularly onerous, challenging, cumbersome for for small counties. And I'm trying to remember back, was there a decision made by the commission? I'm trying to understand, is it the center of vision is a continued process of improvement? Like, how did we get here? How do we make sure that,
Well, none of us, I was not here. Some of us were here at the commission side, right? So my understanding of the history, and Martha and others will correct me, is that it was given as an allocation, and I don't know if it was an internal or external audit, that legal counsel, and I would say 3 different legal counsel have confirmed that we should not give out straight allocations before. Just internally from our side, I understand you want to have the conversation, but 3 different legal counsel, 3 different humans with JDs that said we can't do that. So when that change happened, we did contracts with DGS, which is not fun, because we don't, with our NCBs, our internal, when we contract with, it's an extra burden because we have to go through.
it wasn't a decision made by the commission, there were some outside forces.
The commission as legal advice internally, yes, right.
It would actually, sure.
So actually, I've kind of watched this morph throughout the years.
Yeah.
Where it started as an augmentation, and then with, it was several rounds of that augmentation, and then the additional reporting or activities and, financial reporting started to morph and increase. And then I would say this last round was like way up there.
So it wasn't
So
overnight.
It wasn't, it was not overnight.
Okay.
It actually just continued to kind of escalate, I would say. And it also depended on staffing, First Life California staffing, you know, and decisions that were made internally. Just to be honest, I think that's what happened. I mean, I participated in all of them.
No, that's
So I think that's true.
helpful, and I know I'm looking at time, but I think just understanding how we got here is helpful for me as, you know, making decisions moving forward, and so thank you for sharing.
I had, there was, the last one with SBCFA, when the commission was different, there was robust discussion. And, you know, from possibly an ex officio, who maybe wasn't eating, had certain criteria, certain things that.
I can
Okay,
share.
I'm sorry. I'm sorry. I know.
I was there, I'm sorry, in supporting California's children, I have to go home and get on a
Yes.
flight to support one of my children. But, I will say this, you know, we had some presentations, some years back. And, it was wonderful for me because it was I'm from LA, from Orange County. So it was a really eye-opening in terms of what were some of the challenges, the transportation, the geography issues. Yes, there was a very lively conversation, as 100% of the counties didn't feel that way, as you can imagine, right? And so I think there was, some feelings that there was to ensure that, since every county wasn't going to get this distribution of money, I want the allocation, augmentation, that there be, you know, measurements in place, to ensure, you know, the use of it. I remember that, and there was someone who felt very strongly about that, and I'm not gonna say who, because I actually don't remember. But it was coming from the perspective of some things, in the state where other departments were putting some of those same things in place. So it was never about the small counties. It was a real push from, someone from the governor's office. But I don't think we ever knew any of the details around what those burdens were gonna be. So I don't know if that's the extent of my knowledge, but I wanted to throw that in because I was there and I can remember something.
Thank you. So when the question is, was it a commission decision at this body? Yes.
Well, and I'd like to add one thing to that as well, at least at a staff level, when we were working together in 2020, it was represented that there had been a state controller's office audit, which was forcing a change in the direction of the program. But we had asked for a copy of the audit, we never got it, and we then learned later that such an audit didn't exist. So it seemed to morph from this audit to then, well, these are contractual rules that the state is imposing. So that's, because was my recollection of why the program took such a red.
Thank you so much. This is, the start of a conversation.
Yeah.
And we have a lot to look into. We appreciate you raising the concerns, the needs of families and children in California. And Jackie and I, Director Long and I just conferred, happy to take a closer look at this. I'll let you
And staff are, right, but you've heard from Nina and others that we have taken seriously the letter. Regardless of this, we have to move forward at some level, right? We can say, this commissioner said that or whatever. I think that we hear you and receive that. And what you're hearing is, I love that the investment of time and energy that staff have put in, is that you're seeing a lot of it.
Yeah, I will confirm this. Anecdotally, it's the first time I'm starting to hear this. It's been in the last 30 to 60 days. So
I really encourage on this work with small counties as well as the prior presentation, the First Five Association did, just underscore what the commission has called that partnership and collaboration, working with the team, to think about how we collectively can work together for kids. I would ask Jamie or Simon if we could have the presentations. I'm not sure we got all the First Five Associations PowerPoints, as well as the Rita's PowerPoint. That would be terrific. Any other comments
I don't know, I like to thank Nicole from MoDOT because I went on my computer to see where is MoDOT.
I just have to say thank you to the state commission.
I have to say I did that for a couple other counties in Orange County, so.
Your time and attention. Very
Yes.
good.
Thank you. Any other comments?
I just wanted to underscore Modoc County is also going to have more births in the upcoming year. Our Head Start, our Head Start partners told us. Yeah, well, out of their 4 counties that they serve Sierra, Lassen, Modoc, and Plumas. We have the highest projected births. We're looking at an increase while they're looking at either stagnant or decrease. So I thought that was kind of funny.
Okay, well, I'm gonna come to
Thank
MoDOT.
you.
And I really want to say that, maybe not necessarily MoDOT this year, but we are very committed to, through Director Wong's leadership, to be part of an indie development.
And can I just, and you've heard this last year and this year, is that this is our biggest equity investment, right? And we're committed to you, our staff, we're committed to you all. I can't speak on behalf of the commission because it's a commission conversation, but a proposal will be brought back. So if I can say that, that's our intention. And I've said it and I'm consistent. If you know anything about me, I'm a very consistent person.
Thank you all for your travels and take care. Have a safe trip tonight. And thank you. Motion time.
Your motion to adjourn.
So is there a motion to adjourn? Okay, all in favor? And Lori, Commissioner Rizzo, I will just
Have a safe flight.
Yes.
You're getting.
Well,
We'll talk.